Good morning, guys. Thank you for coming in on time. And the floor is Dr. Kiara Noli. A round of applause, please. All phones on silent, please.
Okay, now. This microphone is working now?
That is working, this is working.
Yeah, but I don't want this one. Okay. Can you hear me? Yes, okay. This is my first time in India, and I am very honored, happy, flattered to have been invited. It has been many years that I wanted to visit your country, so I am extremely happy to be here. Thank you to the Indian Association of Veterinary Dermatology. And the fact that we have an Indian Association of Veterinary Dermatology is magic, is fantastic. And the fact that there are already so many vets, colleagues interested in dermatology is also very nice. Now, I like cats, and you see here I have edited the book of feline dermatology together with my good friend Silvia Colombo. And we see many, many cats. Now in Italy, the people don't make children anymore. The Italian population is decreasing. We are getting old. And this is one of the reasons why the people take more cats. It's like a small child. And also we live in cities quite a lot. And so it's a good animal for the apartment. I would like to know how is the situation here in India. I do not know, I do not care about how many children you make. I imagine more than us, because I have seen lots of children on the plane. I have seen lots of children in the airport. But what about cats?
Yeah, a lot of cats.
A lot of cats. Okay. Okay. So, do the people care about cats? Yes, because in Italy, they spend much more money for dogs and less for cats. So how is the situation here?
Here it is almost coming equal.
Okay, equal. This is very good. Another thing that I have noticed, that for every 1,000 dogs I see more or less 150, 180 cats. So I see much less cats than dogs. What is the share when you visit animals in dermatology? More dogs than cats? More dogs. I have the impression that cats have much less dermatological problems than dogs. Or at least if they have them, the owners will not notice, or they will not bring the cats to the vet. But, and so this is one of the reasons why feline dermatology is more recent, is less developed, and like in dogs, the majority of the animals have allergy. And canine atopic dermatitis is a very good model for human atopic dermatitis. And so a lot of money has been put into research because it is a human model. And very little money has been put into feline atopic dermatitis research. So we don't know very much. That is, unfortunately, the situation now. So from this starting point, I would like to show you, this is an issue of veterinary dermatology of last year or 2 years ago that was completely dedicated to feline dermatology. And that is really, I think, the breakthrough that cats have their own role in dermatology. They are not small dogs, just that we understand this. And this is my cat. He actually, unfortunately, passed away last year because of infectious peritonitis. But this is one of the many cats I have at home, just that you know that I am a cat person. Okay, so we are going to talk about pruritus. How do we approach the cat with pruritus? Because this is one of the most frequent presentations. First of all, we should know what are the causes of pruritus. And at least for what has been published, It will depend from country to country. Flea bite hypersensitivity is one of the major causes, about 1/3 of the cases. With this hot and humid climate, I would imagine that you have a lot of fleas, right? Okay. What about flea control? Do you use a lot of flea control? Do your owners use a lot of flea control? Because in Italy, they only use it from June to September, and then they stop. And that is a mistake, because in September, we have a huge population of fleas outside, and then we have a big problem in September. Okay, then we have food hypersensitivity, atopic dermatitis, that is the allergy towards the environmental allergens. Then we have other miscellaneous diseases, and then we have, among these other miscellaneous diseases, the parasites. And let us see the parasites that cats have. Now, I do not know if you have notoedris, because we don't have it quite a lot. Do you see a lot of notoedric mange in cats? Yes, plenty. So you are very lucky, because unfortunately we don't have it anymore. And these are some photos of the rare cases that we have. At least I live in northern Italy. We don't have it in northern Italy, but in southern Italy you can see it. The nice thing is that when you make skin scraping from these crusts, particularly on the ears, you see a lot of parasites. That is different than canine mange. In the dogs, you don't see a lot of sarcoptic parasites. In the cat, you see a lot of parasites, and these are the eggs, and these are the feces. Another parasite is Scheletiella. We have this. It is very hot here. Are you also warm? Yes? Okay. We have Scheletiella in shops, in breeding facilities. I do not know if you have Scheletiella. You do? Okay. And you recognize Scheletiella essentially for two things. The first thing is that the owner scratches. And so you should ask the owner, maybe do you scratch? And they will say yes, and they have small dots on their abdomen, on the arms. But also, when you see Scheletiella under the microscope, it has these hooks. Did you have Scheletiella yesterday? No. No? Under the microscope? No. In the workshop, yes. You did have. So those that were in the workshop, you could see that it has these hooks on the face here. Then we have Demodex gattoi. This is a rarity. I have never seen it. This is a short Demodex that makes cat scratch. It is quite easy to find it with skin scraping, but the funny thing about this Demodex is that it is contagious. So we always say Demodex is not contagious, right? But this Demodex is contagious. So you may have more than one cat in the house that has pruritus. So when you have pruritus in a cat, you should always think of this parasite too. And then, of course, fleas. When the cat has a lot of fleas, usually it becomes tolerant. That means that it will not have a lot of pruritus. But some cats, they will become allergic. And in this case, the pruritus will be on the back, on the tail, on the abdomen, and also a little bit on the face. In dogs, you usually have it on the back. But in cats, remember, you can also have pruritus on the face for fleas. That is very important to remember. Now, if a cat is allergic, he will be disturbed quite a lot by the fleas. And so he will try to chase them and eat them. And that is how they get tapeworm. But the point is that the allergic cat will not have a lot of fleas on its body. And it will be difficult to convince the owner that this cat has flea bite allergy, because there is not a lot of fleas on the body. And then, of course, we also have food allergy. And food allergy is, I would say, that about 1/3 of the allergic cats could have food allergy. So it's quite an important differential diagnosis. We have pruritus, particularly on the face and also on the abdomen. This does not mean that a cat with pruritus on the face has food allergy, but the probability of having food allergy is greater because it is typical to see it on the face. Head and face, about 53% on the ears, on the abdomen, and on the paws. And then lastly, we have atopic dermatitis. And this is the allergy towards environmental allergens. For example, house dust mites. Now this is a house dust mite from my house dust. So when you go to your house, you collect the dust, you put it under the microscope, and you will find the mites. And that is really nice. We have dermatophagoides. You may also have Blumia tropicalis, maybe, which we do not have. But they all cross-react very much together. They also cross-react with storage mites. And there are some theories now that say that maybe the allergy, the positivity to house dust mites, is a cross-reaction with Toxocara canis. So that in dogs, the dogs that had ascarids, helminthic infestation, when they were puppies with Toxocara, they may react positive to house dust mites. That is really interesting. Other allergens are the molds, Penicillium, Aspergillum. We also have a lot of pollen. Of course, the pollen in my country will be different than the pollen in your country. Do you have any particular plant that is very allergenic here?
Yeah, we have listed. We have to do study on it. All over India, we are going to do in each state because we have got various population.
Yeah.
Variety of things there.
I was told that India is big as 3 times Europe. So you may have very different plants in the whole of India.
Even within that state, we are having many difference in the pollen.
Okay.
So we had to do a great study, so that we are planning. Even
is
next
great.
year we will be starting. So we will need your help to coordinate all these things.
Okay.
We'll do that.
And also the pollen, they travel. For example, there are some pollen that were not indigenous in Italy, and they were in the United States, and they started to be seen all around the airport of Milan. Because probably with the planes, with the people coming from around, these plants have started coming in other places. So that is also very interesting. Now, the cats that are allergic to environmental allergens, they are atopic, they have an average of 2 or 3 years for the first clinical presentation. That is when the owner gets aware about the problem. That does not mean that they develop the disease at this age. They probably develop it when they are younger than 1 year of age. It is a very slow development, but it gets obvious between 2 and 3 years. And that is a little bit later than in dogs. In dogs, it is between 1 and 3 years. And however, the majority of the cats, up to 72%, are younger than 3 years. So if you see a cat that was perfectly fine and at 8 years of age starts having pruritus, most probably this is not an atopic cat. It has some other disease, because this is not very probable. Usually you see it by 3 years of age. And another point is that at least in Italy, it may be very different here. The seasonality of the signs in cats is not so frequent. 10 to 20%. In dogs is much more. Dogs are much more seasonal. Cats tend to be allergic the whole year round. Maybe because they live more at home, at least in Italy. They are in apartments, and so they are allergic to house dust mites, not so much to pollen. Okay. Now we have seen the causes of pruritus. Let us see what are the lesions that are associated with feline allergy, because cats have very special, very particular feline typical manifestations of allergy. So these are the different manifestations that we recognize. The most frequent one is licking, self-induced alopecia. So you see the cats lick and lick and lick. Up to 100% of the cats, they lick too much. And when you ask the owner, does your cat have pruritus, the owner will think of scratching. They will not think of licking. So maybe they say no, but then you see that the cat is completely alopecia on the abdomen, and you say, but it's licking. Yes, it's licking, but has no pruritus, because they think of scratching. So you should ask, is the cat licking too much? Is the cat scratching too much? What is too much? What is normal? Well, it has been determined that if a cat licks for more than 1 hour total per day, that is too much. And if it scratches for more than 1 minute total per day, that is too much, that you have an idea. Then we have excoriations on the head and neck. This is a place that the cats like to scratch very much with the hind feet. That is obvious for the owner that the cat has pruritus, and they can make really big lesions. We will see that. Then there is a disease called miliary dermatitis, and it is seen in about 20 to 40% of the cats, and these are very small crusts, and they can be on the body. They can be associated or not with too much licking. And then we have the eosinophilic dermatitis complex, which is not so frequent, up to 1/4 of the allergic cats, but is very typical. And in the complex, we will see that we have the plaque, the granuloma, and the lip ulceration. So we're starting to see these signs. And here we have the self-induced alopecia. So we can have it usually on the abdomen, sometimes on the back. When I see it on the back, I think more of flea bite allergy, for example. This cat is licking not only the abdomen, but also the lateral thighs, the legs here. But how do we convince the owner that this is due to licking? Because many times the owner does not see the cat licking. Maybe the cats are licking in a moment or in a place where the owner does not see them. So we can do the trichogram. Yesterday you did the trichoscopy, right? Who were there at the practicals? So you just pull the hair and you check. You will see that the tips, they are all broken. And you will also see that many of the roots are in the anagen phase. They are round, they are well pigmented. So the hairs are growing normally, they are very healthy hairs. It's just the cat that is breaking them by licking. What are the differentials? Well, cats are not only licking because they have pruritus. They may lick for other reasons. And the main one is because they have a psychological disturbance, they're very frustrated, and so they are self-harming themselves. Like the children after COVID, that we have a lot of self-harming because of the frustration, at least in Europe. Then we also have licking due to pain. If they lick the abdomen, they may have a cystitis. This could also be a stress cystitis, remember. So that can be all connected in cats. Psychology, dermatology, and other organs, they are all connected. If they lick on the shoulders, like this cat, he may have flea bite allergy, but he may also have some osteoarthritis on the back. Sometimes we do not recognize, but cats have, maybe more than dogs, also osteoarticular pain. And they can have a bold abdomen for other reasons, not because they lick, but because the hair is falling spontaneously. And that can be seen sometimes with endocrine diseases, Cushing's disease, with paraneoplastic alopecia, although these situations are quite rare. So this is a cat that has Cushing syndrome, and it is a cat that has a very thin skin, like in dogs with Cushing. And this thin skin is so thin that it will tear, it will open up. So in this situation, it is not the cat that has been licking, but it is an endocrine disease. So the hair is getting out on its own. And that is a paraneoplastic alopecia. Here also the hair, if you pull it, comes out very easily. So that's not a self-induced alopecia. and usually cats that have a paraneoplastic alopecia have a pancreatic tumor. And these are very rare conditions. So 99% of the cases where you see a cat that has alopecia, it is self-induced. Okay, then the second presentation is the scratching on the head and on the neck. And you see that cats can do very severe lesions. And the typical area is between the ears and the eyes. So this area here where they have lesions, but also the cheeks, the neck, here the cheeks. You can see here the crusts that are linear because of the nails that are scratching. And here you see also some very severe lesions. So there are many, many reasons why cats scratch on their head. May I say something? I see lots of people taking photos. That is perfectly okay. But in your proceedings, you have all these slides printed up, right? You can take photos, it's not a problem. But just know that in your proceedings, you have the same photos. Okay, so cats scratch because of many reasons. Not only for allergy, but also for parasites, notohedric mange, autodactic mange, for our other diseases like pemphigus, dirty face. We are going to talk about pemphigus tomorrow or this afternoon. Then we have herpes virus infection, and we have a disease that is called idiopathic ulcerative neck lesion of the cat. And these are cats that scratch a lot, and we don't know why. They are not allergic, they have no parasites, and now recently we think that that may also be a psychogenic problem. Okay, so just to show you some differential diagnosis of allergy when cats scratch their face. This is another severe case of notohedric mange. You see the crusts and the pruritus. This is another case we saw before of notohedric mange. These are cats that have dermatophytosis. They have crusts on the face. I imagine you also have dermatophytosis? Yes. Okay. If you put these cats under the woods lamp, they will be fluorescent, like when you go to the disco, and you can see fluorescence. Okay. This is pemphigus foliaceus. We're going to talk about it in another lecture. Cats with pemphigus have crusts on their ears, on their face. This is an autoimmune disease. And then we also have herpes virus dermatitis. This is quite rare, but it can occur with crusts on the face. These are cats that had herpes infection when they were kitten. The herpes, we know, remains latent in the nervous ganglia, and then it can come out when the cats are immune suppressed, like our lip herpes, and then it can get these facial lesions. It's not often the case, but it can happen. And this is the dirty face of the Persian cat. This is something that we see in Persian cats. Well, if you see a name like this of a disease, it means that we don't know what is the origin, because this is the fact. These cats have a dirty face, we don't know why. And what is the therapy of this dirty face? To wash the face of the cats every day. If they have a dirty face, we wash them. Well, you laugh, but antibiotics, antifungals, cyclosporin, corticosteroids, they don't work. The only thing that works is to wash the face to the cat. Now, luckily, Persian cats are very nice, so they can accept it. Okay, and this is what I wanted to tell you about the idiopathic neck lesion of the cat. They can really do big, big holes in their neck, sometimes all around the neck. You have seen it? And this was a very important article. They took 13 cats with this problem. They analyzed their wellness or well-being, welfare at home. All cats had problems with welfare. They corrected the welfare at home thanks to a behaviorist, and they all went in remission. Just one, they could not correct the problems, and he had to take psychotropic drugs. But this most probably is a self-induced lesion due to psychogenic unwellness. Okay, then we have miliary dermatitis. So these are very small crusts, and they can be in areas where the cat is licking, but they can also be in areas where the cat is not particularly licking. So sometimes you have to move your fingers in the coat to find them, you have to open the hair to find them, and these are small crusts. Now, when you lift the crust and you make an impression cytology, and you did that yesterday, of course, what are you going to see in your cytology? Lots of eosinophils. You see, they have these red granules in the cytoplasm, and they have these nuclei with two pieces. I always say that eosinophils wear sunglasses because their nuclei has two pieces like sunglasses, right? Ray-Ban. You have Ray-Ban? Okay, so it's the same. Well, when we do a biopsy, we see the small crust. You see, this is a crust, and there are lots and lots and lots of eosinophils. So that is obviously an allergy because there are lots of eosinophils. However, remember that clinically, there are rare cases of dermatophytosis that can mimic miliary dermatitis. Now, I have been doing dermatology for 30 years, and I saw one case of dermatophytosis that was identical to miliary dermatitis. So that is not so frequent. But remember, if you have miliary dermatitis, maybe take material from a crust, make a fungal culture. Did you do fungal cultures yesterday? Of course. Yes, you did not. Okay, make a fungal culture and check. Okay, and then we start with the three members of the eosinophilic granuloma complex. And the first one is the eosinophilic plaque. Now, usually it is on the abdomen. It can be on the inner part of the thigh. Here you see it well, and here you see it also well in the inner part of the thigh. But we can also have eosinophilic plaques in the paws, like in this case. Remember that. So this is exactly the same lesion, but it is between the foot pads. These lesions are usually elevated. That's why we call them plaques. They are round, and they are eroded. They are oozing some material. And when you do an impression smear cytology, you will find neutrophils, bacteria. Many times you will find bacilli, that means rots, because this is the bacteria from the mouth, because these lesions are caused by constant licking in this area. And so we will have the bacteria of the mouth in this necrotic, purulent exudate on the surface. But you may also find eosinophils, because these are lesions that are very eosinophilic. I'm sure that you have seen this in cats. And as I said, you can find eosinophils in cytology, but you can also find neutrophils, like in this case. This is a neutrophil. And you can also find bacteria in the neutrophils, because there is the contamination from the oral bacteria flora. Histologically, this is very similar to the miliary dermatitis we have seen before. So there is a crust, but the crust is not small. It's big, of course, because the lesion is not small like biliary dermatitis, it's big. And under the crust on the surface, here in the dermis, you will find lots and lots and lots of eosinophils. You see, this is all red because of eosinophils. So there are some people that think that miliary dermatitis may be the initial lesion, and then when the cat licks and licks and licks and licks, the lesion becomes greater and greater and becomes a plaque. Now, what are the differentials of eosinophilic plaque? Now, any disease that has a plaque, particularly on the abdomen, may mimic eosinophilic plaque. For example, we have xanthomatosis, which is an accumulation of lipids in the skin, and this is due to a metabolic disorder, that the cat does not metabolize well the lipids that are in the blood, and so these lipids accumulate in the tissues, and if they accumulate in the abdomen, they can give plaques. We can have, of course, multicentric mast cell tumors. We can have other diseases where we see erosions on the abdomen. We will see later pemphigus has lesions on the abdomen, erythema multiforme, mycobacterial infections. They like the fat of the abdomen of cats. Do you have mycobacterial infections? Not much. Okay. And another thing that you should know is that cats, they can develop malignant infiltrative angiosarcomas in the dermis of the abdomen. And so they have plaques on the abdomen. These plaques are oozing some liquid because these are vascular tumors, and they can mimic these plaques. I'm going to show you some examples. So these are mast cell tumors, multicentric, and here some of these are ulcerated. They are plaques. You can see it here too. And of course, when you do cytology, you will see the mast cells. This is xanthomatosis. These are also plaques on the abdomen and also lesions in the interdigital space. Particularly this one can be very similar. Xanthomatosis is not a frequent disease. We see it in young cats. It has a genetic problem. It is a genetic problem of lipid metabolism. This is an erythema multiforme. We're going to talk about this disease in the lecture regarding immune-mediated diseases. It can be caused by drug reactions, by herpes virus infections. This is a pemphigus foliaceus with lesions on the abdomen. This is a hemangiosarcoma with a large plaque on the abdomen. And this is a mycobacterial infection with a large plaque that is ulcerated also on the abdomen. However, if you see, these lesions are sort of different. They are not elevated plaques with this necrotic ulcerative oozing material on the top. Okay, the second member of the eosinophilic granuloma complex is the eosinophilic granuloma itself. And we have several typical localization. One is linear on the caudal thighs, you see, bilateral. And this is like, it starts with a series of papules and then it becomes linear. In the beginning, it is completely asymptomatic. The cat does not know that he has this lesion, and then he starts to lick at these lesions, and then they become eroded or ulcerated. We can have nodules on the chin, sometimes also next to the lip canthus here. And very typically, we can have this granuloma on the palate, and that is between the hard and the soft palate. Sometimes these lesions can become so big that the cats have problems in swallowing the food. So these are the chin lesions. Here you see it. The color can be yellowish to pinkish, and this is at the corner of the lips. Also yellowish to pinkish papules. You see it is yellowish, and it can ulcerate and get some crusts. This is the linear granuloma. This is unusual. It is linear, but it is not caudal. It was lateral. We see that. That is not frequent. I have also seen it once on an axilla. And we also have granulomas next to the foot pads, here or here, that can mimic the eosinophilic plaque. And then we have the palate. This is one that is not so developed. This is one that is more developed. So every cat that comes to your clinic, you should always open the mouth and check if they have a granuloma in the palate. But not only in the palate, we can have it also in other places in the mouth. This is under the tongue, on the tip of the tongue. This is lateral to the tongue. This is on the bottom of the mouth. Now you should make a biopsy in these cases, because for these lesions, the most important differential diagnosis would be a squamous cell carcinoma. So it is very important that you identify that this is not a squamous cell carcinoma, because this you treat with some corticosteroids. A squamous cell carcinoma, you have to cut the tongue away, so that is sort of different. Okay, so how do we recognize the eosinophilic granuloma? Well, histologically it's very easy. We see a mass of material in the dermis. This is a eosinophilic degranulation material, and this is surrounded by multinucleated giant cells. So this acts in the body as a foreign body. And so there is a foreign body reaction with macrophages, that is why we call it granuloma, and multinucleated giant cells that eat this up. So the diagnosis histologically is very, very easy. What are the differentials? Again, xanthomatosis, but also nodular skin infections and nodular tumors. For example, squamous cell carcinoma. So this is another case of xanthomatosis, and you see the lesions are very, very similar, practically identical. This is a squamous cell carcinoma that looks like eosinophilic granuloma, and this was a deep fungal infection, histoplasmosis, that also looked like a squamous cell carcinoma. Do you have deep fungal infections besides cryptococcosis? You have sporotrix?
We didn't document anything.
Okay. But sporotrix, somebody said yes? Because the climate, I think, would favor sporotrix. So sporotrichosis in cats, I have a good friend who is Han Hock Soo. He gave you lectures, right? And he is in Malaysia. I don't know how different the climate is from here and Malaysia. Almost the same. And he has big, big problems with sporotrichosis in cats, and it can really mimic some eosinophilic disease. And then the last member of the eosinophilic granuloma complex is the indolent lip ulceration, and you see we have this ulcer on the lips. The lips can be very fibrotic, very thick. They can have this necrotic material on top. Usually the cats don't have any problems with that. Sometimes these lesions are so big that they can hinder the prehension, the taking of the food. Okay, now I would like to show you the last allergy that I think you should be aware of, because you also have mosquitoes here. You have malaria, I guess. You don't have this problem? Well, we do have mosquito bite allergy. We have mosquitoes. We have even tiger mosquitoes, but we don't have malaria, thanks God. So this is a photo from Ken Mason. Ken Mason is the one that described this disease. He is from Australia. Do you see the mosquito here? The cat develops lesions. And this was the initial presentation of this cat. He hospitalized the cat in a place where there were no mosquitoes, and the cat did much better. The cat went back home where they had mosquitoes, and he was developing the lesions again. And so what we usually see is on the nose some papules that are eroded or ulcerated. When you do impression smear, they are full of eosinophils. And you see other cats, and also the ears. So the nose and the ears, they have papules and erosions and crusts. And this is another case from Latin America, from Argentina. So remember, not only the nose and the ears, but also you can have the lesions on the paws. Okay, histologically, lots of eosinophils, Now, I would like to continue by telling you that not only we have allergies and the clinical presentation of the allergies, but we also can have complicating infections. So these lesions may get secondarily infected, of course. This is less frequent in cats than in dogs. In dogs we have lots of pyoderma, lots of malassezia, and this may be because cats are different. So the barrier, the skin flora, the immune system, they are all different. However, we do have some cases of pyoderma also in cats. And of course, the bacteria that cause pyoderma in cats are the same that live on the skin. In cats, we have Staphylococcus pseudointermedius like in dogs, but we also have Staphylococcus aureus more than in dogs. And that maybe is because the cats, they may live closely together with humans, or they can take this bacterium from humans more easily. Then we have the bacteria from the mouth. As I told you, the cats lick a lot, and so they pass this bacteria on the skin, like Pastorella multocida. Now, I think that if a cat gets a secondary bacterial infection, it is because it is an infection of lesions that were already there. Lesions due to scratching, lesions due to licking. And then there is an open skin, there is an ulceration, the bacteria take advantage and cause an infection. So excoriations, plaques, we have a secondary bacterial infection. So you can imagine that if a cat scratches so much to make these huge lesions, then you can easily have a secondary bacterial infection. And if a cat licks so much and there is a lot of bacteria in the mouth, he will erode, he will cause lesions to the surface of the skin. These bacteria of the mouth, they will give this necrotic, purulent material on the surface of the skin. And we can see that also very well when we do skin biopsies. This is the epidermis, this is the dermis, this is a crust. Look what we find in the crust, lots of bacteria. We don't see this in dogs. We see this much more in cats. Okay. So the majority of the pyoderma, of the infections in the cats, are in the face and neck. That is typical of secondary infections of the cats, and there is an underlying allergy in the majority of these cats. How do we diagnose it? Well, we do an impression smear cytology, as you have seen yesterday. We stain the glass slide, and when we pass it in the alcohol, in the red and in the blue stain, and then we rinse it under the tap water, we can find neutrophils. So all these cells, they are polymorphonucleated with many pieces. They are neutrophils. And within the neutrophils, look here, in the cell there are the bacteria. And here we have the cell, and in the cell there are the bacteria. Now it is important that we check with the shape of the bacteria. Because if it is a round shape, we know it is Staphylococci. If it is a rod shape, like in this case, we do not know what they are. So in this case, we have to do a bacterial culture to know what bacteria they are. But why is this important? Because if we want to give antibiotics, if it is Staphylococcus, we know that more or less it will be sensitive to amoxiclav, it will be sensitive to first generation cephalosporins. And this is the first line antibiotics that we should use. We should never use quinolones as the first line antibiotics, never. But if it is rots, we don't know if it is Pastorella, coli, Proteus, Klebsiella, whatever. So we have to do the susceptibility test to know what are these bacteria susceptible to in order to be able to choose the best antibiotics. Now the best antibiotics are for the first line always amoxiclav and cephalexin. Only if amoxiclav and cephalexin are not working, then you can use quinolones. That is very important, otherwise we will get a lot of bacterial resistance. Okay, so sometimes we also see eosinophils together with the bacteria in cats, of course, because this is an underlying allergy. And then the other complicating infection that we see in dogs, but in cats is much less frequent, is malassezia. So in this case, we have a greasy skin, we have alopecia, we have erythema, we have pruritus. This is one of the very few allergic cats that I have seen with a generalized malassezia infection. You see that there is alopecia, the skin is greasy, the cat has a lot of pruritus. Usually if a cat has a malassezia infection, you should check for an underlying disease. Not only allergy, also diabetes, a viral infection, a tumor, a severe underlying disease. But if you don't find anything, like in this case, we could determine that this malassezia was due to the underlying allergy. So only 30% of cats with a generalized malassezia infection has an allergy. Remember that the majority has another severe underlying disease. I said paraneoplastic syndromes, thymoma, metabolic diseases, and so on. And the other way around, of all allergic cats, only a minority develops a malassezia infection. This was a study by Laura Ordeish, and they have checked cats that had allergy and malassezia. And in this case, they could see that the majority of the cases, the malassezia was on the face, on the neck, sometimes in the ears, and it was treated like in dogs with imidazoles, either itraconazole or ketoconazole, with good results. Okay, now there are 5 minutes left for the questions, but I would like to start talking about the World Congress. So those of you that are very interested in dermatology, every 4 years there is a World Congress of Veterinary Dermatology, and that will take place next year in July 2024 in Boston in the USA. This World Congress has like 8 parallel streams, so there is a lot. Some are basic, some are more advanced, some are for horses, large animals, cats, exotics. So there is lots for everybody. So if you want to remember to start saving money for this Congress, it will be a very interesting possibility also to meet other people from all over the world. There are over 1,500 participants from all over the world. Okay, I'm ready for questions for this first lecture. Do you have any question? Yes?
The demodex, you are sure will be communicable to humans also, or only the...
Okay, that is a very good question. The demodex can be transmitted to humans or not? No. Demodex are very species specific. So the demodex of the cat will never go to the humans or will never go to the dog. You have your own demodex. And if you take your eyebrows and you put them under the microscope, you will see your demodex there. Everybody, now 50% of the people in this room has parasites in their eyebrows. Are you happy about it? You should check. Eyebrows and eyelashes, they often harbor demodex. So you go home and you do it under the microscope.
One of my friends shared mite from the skin.
Mites from the skin?
Yeah, I think
Sometimes you can have demodex in the skin, sometimes you have it on the face, sometimes it causes rosacea. There are, like in dogs, immune-suppressed people that have demodex not only on the eyebrows, but they can have it in other parts of the body. Now, I didn't say it, but it is very easy now to eliminate every parasite from cats and dogs by using isoxazolines. We'll have, and you may have Bravecto, NexGard, Simparica, Credelio. It's not an isoxazoline, but it works very well too. Felpreva, you have Felpreva? No? Okay. So when I started being a dermatologist 30 years ago, just that you know how old I am, we had to wash with amitrats half of the body on alternate days. That was horrible. It was intoxicating. It was, and before, you may have read James Herriot. Anybody has read James Herriot? Yes? They were euthanizing dogs with demodicosis. And now we give a pill. That's done. Isn't that fantastic? Yes. Okay. Any further question?
In Malaysia, can you use ketoconazole or shampoo?
Okay. Now, for malassezia, you could use ketoconazole shampoo, but cats don't like shampoos very much. So then it would be easier to give itraconazole, like for dermatophytosis. That is much easier, yes.
Thank you. That's a very nice lecture.
For dermatological disorders, we take blood sample. This is general procedure. We take blood sample
Yes.
for CV related other tests. In dermatological cases, invariably, we see that there is a neutrophilia,
Yes.
and even after the treatment, after the remission of the neutrophilia in particular, it persists. Even after, say, 1 month or 45 days post-treatment. My question is, will it subside in due course, or 1 month or 45 days post-treatment is a meager time? We should wait for some more time to get this picture in the normal state, because we have the client to reply.
Yeah. I have one question for you. How do you treat them?
On what case, all
Can we have a
dermatological cases
microphone
are
that
not.
works?
So you hold it closer.
We treat for different reasons, you know. As a,
But with how? Do you give corticosteroids?
not necessarily. If it is an autoimmune disease, then corticosteroids and it comes into picture.
Okay. Because if there is an inflammation, you have neutrophilia. Okay. If there is stress, you have neutrophilia. Because stress is producing cortisone, and cortisone is mobilizing the neutrophils from the center, from the liver, from the spleen to the periphery. So stress and inflammation, you will have neutrophilia. If you treat with corticosteroids, you will have neutrophilia, because this is caused by the corticosteroids, because it will mobilize the neutrophils to the periphery. So not necessarily, if you don't have an inflammation anymore, if you don't have an infection anymore, the neutrophils will go down. If there is stress, if you treat with corticosteroids, the neutrophils will be still high. That is normal. The eosinophils should decrease if you treat allergy. This is not always the case. Sometimes it's very difficult to treat allergy. The eosinophils should decrease. But you have to know that dermatologists, they don't do a lot of blood samples. We are very much criticized by the internists because they take a lot of blood samples, and we dermatologists, we don't. We look at the surface of the skin. So I do not have a lot of experience with that, because we usually don't take blood samples in our we take it when there is a reason, when we suspect a systemic disease as an underlying cause, when we have to start an important immune suppressive therapy, then you want to know what are we starting from, how is it going to continue. But I would guess that the neutrophils stay high because of stress or because of the corticosteroid administration. Maybe there is somebody else that can comment?
Yeah, one question here.
Yes, please.
Thanks for this nice informative talk. The question is regarding feline dermatitis other than parasitic infestation. So what are common metabolic disorder or diseases which can cause feline dermatitis? like biochemistry profiling and all that.
Okay. I need to know what you mean by feline dermatitis.
For example, like in dogs, if there is a high level of cholesterol or thyroid infestation, skin could be one problem related to that.
Okay. So you're asking about systemic diseases that cause skin problems. Okay, I could talk for 2 hours about this. When we talk about the endocrine diseases, we could have Cushing's, I have shown you. This is quite rare. With hyperthyroidism in cats, cats lick more, but there is not a lot of dermatological diseases. When we have neoplasia, for example, thymoma, we can have a paraneoplastic syndrome, and the cat gets lots of scales. It is called feline exfoliative dermatitis. Another neoplasia, for example, pancreatic tumor, I showed you before, the cat gets alopecia, so the hair gets off very easily. When the cat has a severe underlying condition, maybe a viral infection that is already advanced, a leuemia or a feline immunodeficiency viral infection that is advanced, you have an immune suppression, you may see demodicosis, you may see dermatophytosis. I have seen cases where the cats had both demodicosis and dermatophytosis. When you see this, you should think the cat is very much immune suppressed, and then you look for the viral diseases or for diabetes and so on. Also, paraneoplastic disease, cats that have pancreatic carcinoma, they can have metabolic epithelial necrosis, and the epidermis just sloughs off. There is a detachment of the epidermis, but there have been like 2 or 3 cases described in the world, so it's not very frequent.
Good morning, ma'am. Is psychogenic feline disorder is related to the psychological problem with the owner?
Yes, the last lecture of this Congress will be on that. So tomorrow I can tell you about this.
Ma'am, one question. Should we minimize the use of corticosteroids?
Another lecture will be on therapy.
Okay.
Sorry. Okay, last question and then we have to cut.
So how effective is IgE level detection in determining errors? Like, can we use detecting IgE levels to check for allergies, and how much correlation we can make between those levels and the...
That is a question where the answer is nobody knows. The question was what is the real correlation between IgE positivity in blood and real allergy. For food allergy, this is the next lecture, probably very low. Don't use serum test for food allergy, but I will explain this in the next lecture. For atopic dermatitis, environmental allergy, probably much better because we do hyposensitization and our success rate is about 60-70%. So then the correlation could be 60-70%. But we're going to talk about that in another lecture. We have to finish, right?
Guys, round of applause, please.
Thank you.
Thank you, Kiara. I invite Royal Canine for their presentation. Royal Canine gang, please. Guys, यार phone some अच्छा ringtone बजाओ या phone बंद करो. Request डाला हुआ है. Thank you. Turn silent.
Yes.
Good morning. Thank you. There's a tea break after this session, so would...
Check. A very good morning, everyone. There is a tea break after the session, so would request everybody to stay back in the room, please.
We will be unveiling a new product here, so would really be happy if everybody stays. Very good morning, everyone. I hope everybody is well rested, or we spend the evening catching up with old friends over a couple of drinks. It takes me, it gives me great pleasure to be here in the second Congress. And I was listening to the General Secretary's presentation yesterday and the President's address, and the success that we saw in such a short time reflects basically the number of dermatology cases that we see in our practice. And probably this was long overdue to have a very specialized Congress on dermatology, and therefore we see success year after year. And my, wishes to this Congress to only grow from pillar to pillar and strength to strength. With that, I invite Dr. Balaguru from our scientific communication team to, bring out a topic which I'm sure each one of you will find it very important from your practice, clinical practice management perspective. So without further ado, I hand it over to Dr. Balaguru. Over to you, sir.
Guys, I request, see, the program cannot work without sponsors. Request everybody to just kindly pay attention, don't discuss everything. The voices are being heard right till the front. So just I respect the sponsor. Please give them the time. Thank you.
Yeah. Very good morning, everyone. I would like to I take this opportunity to first thank the organizers for giving us this opportunity, and very warm welcome to this session, which I am going to talking about Royal Canin's new intervention on the treatment and management of canine atopic dermatitis for the long-term interventions. So myself, Dr. Balaguru, I work for Royal Canin. I have recently joined with Royal Canin as a scientific communication specialist. So there were wonderful lectures yesterday, and today we were having from the elite speakers that we have. Just I would like to start my presentation by having a question to you, okay? Because most of you in our day-to-day practices are getting this lot of dermatological cases, and predominantly some are diagnosed in the right spirit and some are not because of the owner's compliance and a lot of other, long-term management of the diseases, etc. So when we talk about canine atopic dermatitis, what is that comes into your mind? Okay, what is that comes into your mind when you think about managing a canine atopic dermatitis? I would love to listen some, challenges that you face in the day-to-day practice. Cost of, yes, of course, definitely it is one of the challenging piece. Client's compliance, yes. Recurrence, of course, yes. Okay, already the answer is also visible. Yeah. So it is definitely is a long-term managemental piece. First and foremost is to convince your client, to make him understand that this disease is not going to be treated in a day or two. It requires a long-term management. It has to be supported by multimodal therapies, supported with food, supported with supplements, and also how to really take care of the recurrence, how to prevent. There are guidelines that has been given by the International Society, how to do a proactive management, and also how to do a long-term reactive management. Okay, these are all the pain points that we see normally in our day-to-day practice. It's and also you see a lot of complaints from the owners because they are not patient enough to listen what the vet really want to say. So definitely they are jumping into different set of jumping with different set of practices, and then have their experiences, ending up not getting treated their pets. Okay, and yeah, of course, Royal Canin. So health is our purpose. Okay, we always wanted to be a pioneer in this line and want to be a reference point for this particular, dermatological range as well. We all know that we have been seeing a lot of cases of dermatology in day-to-day practice, and the research clearly indicates that out of 10, at least one or two dogs, it could vary from practice to practice. It is not that standard, because this is a study that has happened in the western parts of the world. Okay, it can be different for our own country. So, but it is clearly indicated that you get a lot of cases of canine atopic dermatitis. It can be presented individually also, and it can also accompany a lot of other concurrent infections or maybe some other allergies, which can really, make it more difficult for us to really not be able to differentiate between the actual diagnosis and the treatment perspective. Okay, there are a few key facts that I want to talk to you about. See, this canine atopic dermatitis is basically a genetically predisposed disease, which for which individual the the immune system is compromised and skin barrier is compromised, so that the allergens can easily enter into the skin and then cause or trigger the inflammation, and then followed by pruritus, and then you will also see the consequences in terms of the lesions. Okay. And there are few breeds are very commonly being affected by canine atopic dermatitis. I'm just telling you that I'm not really going into very deep into it, because we have elite speakers from all the way from Italy and all. So I will just quickly touch upon so that it will make sense. How is it, whatever the product I'm going to talk will have to be related, and how connected it is with the current day practices that we have. So when the allergy or the immune system is compromised, your skin barrier is again compromised, and which is going to have inflammation followed by pruritus, and then you also get recurrent otitis as one of the common sequelae of this disease. Okay, and canine atopic dermatitis, it can be seasonal and it can be also year round. If you really check the environment where the pet lives, it can be having a multiple number of house dust mites and dandruff, which can be a problem year round. Okay, and this particular piece of diagnosis become very, very challenging. So how do you really rule out canine atopic dermatitis? First, you need to just do the basics work like skin scraping, rule out and eliminate all the non-allergic causes of the atopic dermatitis, and then come to a next step, that is your allergic causes, that is your food allergy and your flea allergy, hypersensitivity. Okay, because these things can be most of the times occurring together, and this is what makes the diagnostic workup very difficult. So once you finalize that atopic dermatitis, it could be in the way of atopic dermatitis. You can rule out food allergy by food elimination trial. That is one of the gold standard method available with us, and then you can come to a diagnostic workup. Just go for the intradermal skin testing, which is proven to be more specific, and find out the allergens and remove all the allergenic sources that is available. Yeah, and you see a lot of cases of atopy presenting with various. Sometimes it starts with lesional pruritus, and then it can be pruritus with a lot of lesions, specifically around the eyes, specifically around the lips, and also you can also have the lesions in the flexural surfaces of the body. Okay, these are commonly presented various clinical signs that you can see. Right, now quickly I'll jump into the treatment modalities, how currently this canine atopic dermatitis is managed. So it is basically to avoid the allergens, avoid all the allergens available, and then go for a multifaceted approach, go for a multimodal treatment. Okay, I'll explain you this in a very simple steps. So the key is first owner compliance, then go for start early intervention. Okay, see, there are two aspects of treatment protocols that is being suggested by the international committee. One is your proactive treatment, wherein you avoid the allergens proactively, wherein you also keep the skin health or skin barrier intact proactively. And the second piece is reactive. So once the flare factors for this particular piece of atopic dermatitis exist, you react to that and treat accordingly and repair the skin barrier, bring it back to normal, and maintain or support the quality of the life of the pet. Okay, and definitely it is going to be a long-term offer, which we should be ready and we should communicate to the pet owner. That is very, very important and success in this particular piece. So this is what comprises of the multimodal management of this atopic dermatitis. First piece is to avoid allergies, and then go for controlling the inflammation and pruritus, which is the immediate threat for the pet owner, which he might not be very comfortable. Remove that piece by treating it with medication or by giving supplements, and then control the inflammation and pruritus, then repair your skin barrier and make it compact. Yeah, now how come in this multimodal approach a food can be beneficial? How come a food can really support in this multimodal therapy? So that is the next piece of information that I want to share with you. So we have also had a good amount of research and understanding from the pet owners and the veterinarians pain point. So 93% of the pet owners stated that atopic dermatitis negatively impacts the quality of the life. Okay, and also more than 50% of the pet owners say this cost of treatment is really, really painful for us. It's very difficult to continue the treatment. And also you have the reason of pet parents multiple times visiting a vet practice because of the canine atopic dermatitis, because of its recurrence, etc. Okay, and for veterinarians, it is time consuming, owner compliance, expensive, long-term management, multimodal approach, and you also have to differentiate between a lot of other, allergic conditions. So what we did, basically Royal Canin, we have, collaborated with some of the key opinion leaders of the world, and then tried to understand how can really we support in this piece of management of canine atopic dermatitis. We came up and we came up with the understanding that there is no strong consensus about the products that is available in the market currently from the key opinion leaders. And also we don't have very strong supporting publications and studies which really supports this foods whatever available. And we also have some information obtained from the KOLs that some of the supplements, like for example your fatty acids, those can be supplemented and those can be of help, but how is it really going to make impact? So that is where we heard the vets' wishes. So what are their expectations? It was very clear. The vets' expectations are very clear. It is not possible to cure the disease. You have to manage the disease. That is the very simplest ask for the veterinarians, ask from the veterinarians. And yeah, of course, nutrition can itself not be a complete solution provider. It should be a multimodal approach, what really we should make. And then you also need to manage the acute flares. Acute flares by secondary infections or inflammation that is being in the process of the canine atopic dermatitis. So what is that we want to provide? We want to reduce the dependency of the drug, because owner compliance is not only regularly bringing the pet to the practice, they also have to regularly follow your medication whatever you are prescribing, right? So that is where you have to reduce the cost of the dependency on the drug and reduce the global burden of this, overall global burden of the disease or the incidence prevalence of this disease. And also at the same time we should try to be cost effective. Okay, how are we going to achieve this? So we also wanted to do a rigorous quite strong knowledge base to support whatever product that is going to come up and support this piece. With that intention, Royal Canin has taken up a study with one of the world's renowned key opinion leader, your favorite et al. Okay, one of the world's renowned key opinion leader who has provided the favorites et al. Criteria. There are some 7-8 criteria to really diagnose canine atopic dermatitis. So you can go through papers that are available. So basically it talks about the onset of the disease will be from 6 months to 3 years, and glucocorticoid responsiveness should be there in this case, and non-affected ear margins, and there are otitis, affected ear pinna, affected front foots. There are 7 criteria of favorite et al. Which can really give you almost 85% of this et al. Criteria is proven to be supporting you in your diagnosis, some closer to 80+% in terms of your diagnosis piece. So a double-blinded placebo-controlled study we have done. Okay, so where we have tested the control diet as well as the test diet. Okay, so we have tested 3 important parameters, which is your first is medication score. How is this diet is really bringing down the medication spent on the medication or the medication sparing effect, and the other piece is how is this diet is going to address the immediate itching and control the inflammation pruritus. Then third is how is this diet is going to really contribute for the reduction in the canine atopic dermatitis extent and severity of this disease. So KDC, okay, so there is an index now, KDC 4 is being followed. So we have come up with the wonderful results that has been proven to be, so this particular diet, test diet, whatever we did, has significantly reduced the medication, that the cost spent on the medication or medication sparing effect, whatever you call. And also we could able to achieve that the pruritus visual analog score was very significantly has been controlled after using this diet for at least, because this is all long-term management, so I would say this, you cannot see any magic in the next immediate week or so. It needs some time. It needs, see, the results also clearly proves that you get the expected results if you are going to give this diet for quite some time, at least for about 8-9 months. So, and it is going to be continued for lifelong. And also the extent and severity index also very much improved in our diet. And this entire piece was also supported by one of the, again, renowned key opinion leader, Pascal Prillard also has acknowledged this piece, and also these publications have been out in the system. So it is clearly stated that almost 82% of the dogs significantly reduce their medication score in the course of 9 months. Okay, and also it is clearly proven that 72% of the dogs which has been significantly reduced, the itching and etc. after 9 months of the course of this diagnosis. So what is that breakthrough innovation what we had? I was talking about a test diet. What was that? What exactly and how is it really going to contribute? Just I would like to take a moment here to go back in the history to talk about the first product from Royal Canin that was developed by the founder of the Royal Canin, Dr. Jean Catherine, the yellow soup, which was very much for the treating the skin infections in German Shepherd dogs. That is the first product that was from the Royal Canin, started with dermatology, and later we have come up 10 years back, we have come up with one of the wonderful product for the diagnosing and treatment of this management of this canine atopic dermatitis, that is your analergenic, which is using hydrolyzed feather proteins with less than 1 kilodalton molecular size of the protein. Okay, and now presenting, and we want to continue to be the reference point of health through nutrition. Royal Canin really want to make, be in that particular platform. So we are introducing now to you the new range for canine atopic dermatitis, Skin Topic. Skin Topic is the product that is exclusively made for management, long-term management of canine atopic dermatitis in dogs. Okay, how is this product is really going to support you? Okay, this product is patented with a unique complex, that is dermoxylium complex. Okay, dermoxylium complex, it contains few of the nutrients. I will talk in the upcoming slides what it really does. Okay, it has really clinically proven to improve the skin health. It has also clinically proven to reduce the itching. It has also clinically proven to have anti-inflammatory effect and also supports the skin barrier function. Okay, so what exactly is dermoxylium complex? Dermoxylium complex contains your licorice extract. Licorice extracts are nothing but your adimadram. We call it in, I don't know, in Tamil it is adimadram. Hindi also, I think most of the times I heard from my friends, adimadram, it is one of the plant extract. So we have tested almost 28 active components from this particular licorice root, and then found that which was really going to be effective and helping in the support of this canine atopic dermatitis management. And the other piece is your curcumin, that is the extract from the turmeric. Okay, extract of the turmeric, and definitely it is also going to contribute. And also we have increased the levels of your fatty acids, your omega-6 and omega-3 fatty acids, and it is also proven that increased supplementation of omega-3 and omega-6 really supports in the reduction in the inflammation and followed by pruritus. And also we have incorporated good amount of linoleic acid and zinc, which is proven to support the skin barrier health. And also we incorporated in this product vitamin A, vitamin E, and your pantothenic acid, niacin, to really support the skin barrier. And also to rehydrate on the skin repair, because atopic dermatitis, if the disease becomes severe, dogs used to go for itching and then becomes really challenging for them to self-mutilate themselves, and damage to the skin happens. To support that, histidine and taurine and lutein complex has also been given. So to summarize, it has got anti-inflammatory action, and also it has got antioxidant property, and also it has got skin repairing property. Okay, so how does the product really supports? It supports by supporting the sensitive skins of the dog, improves the quality of the life. How is it helping the quality of the life? Reducing the itching, reducing the inflammation, and supporting in the long-term management. And also it is cost friendly for the pet owners. The point is here, how is it again going to be cost friendly? Because you might ask me like, so you have lot of products available in the market. Okay, I have to give my food also, I have to give products also. How is it really going to be helpful? Okay, whether you are going to give this food or any other food, you are going to give some food for your pet, right? So definitely it can be a very good very good alternative as your regular diet. In place of your regular diet, you can use this particular product and also have the additional health benefits, and it can become a proactive support, and also it can become a reactive support in the multimodal management of canine-atopic dermatitis. To just summarize the entire piece of information, whatever I shared so far. So first of all, to early diagnosis, owner compliance, and then regular monitoring of this particular disease piece. Yeah, and then use diagnostic tools, try to understand the particular allergens, specific allergens, and if possible go for allergen specific immunotherapies. Along with that, you go for non-irritating or anti-seborrheic shampoo wherever seborrhea you see, or go for anti-bacterial shampoo wherever you see bacterial infections, go for anti-fungal shampoos wherever you have, okay? And also go for a precise nutrition, which is going to be a long-term solution and going to be a very good game changer and having a cost-effective, wonderful treatment. And thank you so much for your patience. I end my presentation with one of the quick small video just for you. Yeah.
Environmental atopy, a lifelong condition. Yet, tailored nutrition has its part in managing the symptoms. Royal Canan's active complex targets inflammation triggers and supports the skin barrier, with a proven decrease in drug reliance. Introducing Royal Canan Skin Tonic, a new diet with proven efficacy in the management of environmental atopy. Healthy skin comes from within. Royal Canan, incredible in every detail.
Thank you so much. This product is going to come in September or October this year. There couldn't have been any better place or stage to introduce the product to our community. What we'll do is, can I request Dr. Nagarajan to step on the stage, and to accompany him, Vice President Dr. Venkateswaran, Secretary Dr. Jayaraman, Dr. Vairamuthu, Dr. Josen, Dr. Karkare, Dr. Noli, Dr. Vishal, and Dr. Balagaru to be present on the stage. We'll do a product unveiling and product reveal. Dr. Karkare, please, yes. So, one of my colleagues happened to be in France last week, and a freshly made product just out of the line we were able to procure. So we'll unveil the demo pack so that everybody can see. At the same time, we'll also unveil the actual pack here. Dr. Nagarajan, if you could just step and reveal this for everyone's this thing. Yeah. Yes. Thank you so much. Thanks for gracing the occasion, sir. And if I could ask Dr. Nagarajan and Dr. Noli to just pull the end and reveal the pack. Thank you so much. And rest of the dignitaries to unveil the product brochure. Everybody will get a copy so that you have the full information of the product with you. the nose. You're being too careful. It's okay to tear the wrap. Yeah. Nice. If I could request everyone to hold the booklet a little high so that. Thank you so much. Thank you so much for all the dignitaries, and as I said, there couldn't have been a better occasion or a platform to launch a derma-based product. I would definitely invite everybody to come to the Royal Canin stall, pick up your copy of the booklet, and handle the pack and feel it for yourself. Thank you so much. Have a nice day. We just missed you. Over to you, Doctor. Yeah, I think since you are here, we'll take a picture if you could. Abhishek, can you take a picture? Yes, in fact, yesterday we caught up and she did mention that. Dr. Maine has actually contributed to the study. We were catching up on that yesterday. And I'm sure for you it will be a culmination of all the activities and the hard work that must have gone behind the product. Yeah, if you could just hold it once again and for the picture for eternity. Thank you so much and have a great day. Thank you. Now is a tea break. There is a 15-minute tea break. It's just about, should be back by 10:45. The 10 minutes, 10 on the clock, 10:45 we'll start the next session. Thank you so much. And thanks the association for this beautiful opportunity. And it's been great pleasure being associated with you. Thank you. Thank you.
Hello everybody. So today we are going to talk about canine atopic dermatitis and in particular how to manage the treatment of this condition. Today we will learn how to take control of the workup of the itchy dog, finding a treatment for acute atopic dermatitis, the long-term treatment, use indication of the new target drugs such as Apoquel and Cytopoint, and the concept of the proactive therapy and the etiological treatment. Canine atopic dermatitis is a genetically predisposed inflammatory and pruritic allergic skin disease, which characteristic clinical feature. As you can see here, pruritus is one of the most common. Most dogs, in the literature, they said that up to 90% of dogs they can experience pruritus. And pruritus can be severe, like in this dog. This is a big problem for, why? I cannot see. Yeah, sorry. This is a big problem for dogs because it can be so severe, and it's not just a problem for the dog, but it's also a problem for the owner itself, and this can really impact their bounds. First, we need to stop the itch. It is very important because the owner, when he comes to us, is not just asking for some recommendation. He wants us that we should help him. So first, we have to provide a rapid itch relief in the meantime that we are doing the workup to understand which type of allergy is it. We need to use a short-term control of pruritus, something that is quick and is effective. And this is, for example, local and systemic cortisone, which act very, very quickly, and we can use for severe and generalized lesion or also in animals that are quite difficult to treat. We can use also in the beginning for dogs that are very heavy and where other type of treatment would have been too expensive. We can use oclacitinib and lokivetimab. They are quick and effective. But maybe we can use lokivetimab for lesions that are less severe, and in the beginning we can use oclacitinib. Second, we have to rule out parasite. You have to think about the lesion, as we saw yesterday, and choose the right test to rule out them. And if you find a parasite, you have to treat them. And remember what I said yesterday, if you don't find them, you have to treat them anyway. Options for treatment trials are selamectin or isoxazoline. We have to rule out bacteria and yeast infection. Both the skin and the ear has to be checked. You have to perform cytology as we saw yesterday. And then if you find an infection, you have to treat them. You need to use orthopical therapy. They are preferable. And if necessary, use systemic antibiotics. But all the time, please use the cultural sensitivity test. 4, we need to perform a strict food elimination diet. The best would be to use a homemade diet with unique ingredients. So there is not, yesterday I heard also talking about which food is better. It's not really, we don't have a diet that is better, one ingredient that is better than another one. It's really based on the history of dogs. In our country, dogs are eating mainly beef, they are eating chicken. So for us, these are not good ingredients to use. In our country, they are not eating horse, they are not eating rabbit, so we use this one. But if a dog already ate rabbit, I'm not giving rabbit. So it's really based on the history. And then if this is not possible, you can use also commercial diets. And when you use commercial diets, it's better to use those that are extensively hydrolyzed. It is better to use those that has a starch instead of a whole grain diets. It has been demonstrated with a study that a starch is less immunogenic than a whole grain. So then when you decide which type of ingredient you use, you have to suggest to the owner to do this elimination diet for 8 weeks. There is also a new study that uses a shorter protocol, and we will see in the next presentation a little more in detail this second option. Here is an example of the elimination diet. You start the food that you choose for 8 weeks, and for the first 6 weeks you give a pruritic treatment, because you don't want that, you want to be sure that the owner will follow this, will finish this test. So you need that the pruritus is under control. After 6 weeks, you stop the drugs that you choose. It can be cortisone, can be oclacitinib, and you monitor the dog. If the pruritus come back, you see the food is still going on, so means that it's not helping the dog. So if the pruritus come back, the dog has not a food allergy, but rather has a canine atopic dermatitis, or means that the owner didn't follow perfectly the diet and the dog eats something else. If after 8 weeks the dog didn't experience a relapse, so it may be really a food allergy, and in this case you reintroduce again the old ingredients to confirm that this is really a food allergy. So in that case that you gave the new food and the dog didn't improve, so and if you really rule out a parasite infection, secondary infection, now you really think, you really can say that the dog has atopic dermatitis. Once you finally diagnose canine atopic dermatitis, you have to think, how to manage in the long term this condition. And this is the most tricky part. Indeed, the ideal treatment should be a target therapy, so means effective and safe, should be easy to be administered, low cost, without drug interaction, and possibly with a fast onset of action. But this is not really important. As you can see here, we can also use in this part the calcineurin inhibitor, which takes a lot of time to work, but you can combine with the cortisone in the beginning. However, one of the most important aspects that I take in consideration is not really this, but is the intensity of pruritus and the severity of clinical lesion that I have to manage. For example, at this point, you just finish your diagnostic workup and the dog relapses when you stop the drugs. Dog maybe at this point he has again a new flare. Indeed, atopic dermatitis typically running in flares, and the flares are often associated with a complex inflammation that is involving a huge amount of inflammatory mediators. And sometimes this target therapy, they have a really narrow mechanism, and they can be not so effective when we have acute flares. So here in this phase that we can also call a reactive phase, dogs benefit most from a rapidly acting and broad targeting drugs. For this reason, my first choice here, when they have a huge relapse, is to give corticosteroids. Once the cutaneous inflammation come back to the mild level, and of course to avoid the long course of oral glucocorticoids, we need now to switch to a therapy such as oclacitinib or lokivetmab, or also with the topical glucocorticoids together to immediately broaden its anti-inflammatory effects. We can also use cortisone not only to reduce the inflammation, but also for its anti-inflammatory action to support lokivetmab. In the beginning, if you have a dog that is itchy at your consultation, you cannot give immediately lokivetmab. You give cortisone the first 2 days to help to decrease this huge amount of inflammatory mediators, and then lokivetmab that we will see in the next slide, which is only antipruritic and not anti-inflammatory, will start working well. You can also use for the fast action to support the cyclosporin. As I said, the cyclosporin needs time, sometimes even 1 month, to be really effective. So you can add in the first 2 weeks, 20 days also cortisone. And also you can use cortisone when the other therapy are not working, but try to give the lowest effective dose and try to move very quickly to the every other day dosage. So now let's see the new target therapies that we have. Before, I would like just to introduce a little bit the pathophysiology of pruritus and their mechanism. So canine atopic dermatitis is an inflammatory and pruritic allergy disease. Pruritus is very common. So pruritus is caused by several factors. And interleukin 31 is an interleukin that recently has been identified and see that is implicated in pruritic condition in dogs. And when we can give an anti-interleukin 31, the dogs stop itch. So let's now look together specifically what's happened in an allergic patients. So when the allergen come and pass through the skin is picked up by the Langerhans cell. The Langerhans cells move to the lymph node and present this allergen, which has catch and then processed, and then it will present to a naive T cells. At this point, this cell is still naive, so means She doesn't know if it's an activating or a tolerating cells. In a predisposed subject, not in everyone, only in those that for genetic and other cause become allergic, this contact will stimulate the production of activated T cells. This activated T cell will then promote the production of immunoglobulin specific against that allergen from plasma cells. This immunoglobulin will then go on the mast cells, on the surface of the mast cells and the basophils, and they will stay attached. At this point, we say that the animals is finally sensitized against that protein. And once again, when the allergen will enter a second time, this time in the skin there will be T cells activating again that allergen, and also a lot of mast cell and a lot of basophils, eosinophils, which with already this immunoglobulin against that allergen. So when this allergen will enter again, the Langerhans cells will present to the T helper cell that this time is activating, and it will produce a lot of interleukin 31. This interleukin 31, it will stimulate the sensory nerves, and it will give this sensation that will go to the brain, and the dog will start to scratch. In the meantime, the allergen can also bind the mast cells and the eosinophils, causing a huge release of inflammatory mediator, which in turn will increase this sensation. Here I have a video. I would like to explain you this, but I found this video amazing, so I will let you follow. This is about the mechanism of Apoquel.
Tablet, mode of action. Apoquel is specifically designed to target the pathways that result in the sensation of itch and the inflammation associated with allergic conditions, regardless of the cause, such as flea allergy or contact allergy. Apoquel selectively inhibits JAK enzymes within cells, preventing the signals triggered by JAK1-dependent cytokines involved in itching and inflammation, and with minimal effects on JAK2-dependent cytokines involved in hematopoiesis or innate immune function. Apoquel works at itch neurons within the skin, preventing the transmission of the itch signal to the brain and the subsequent scratching behavior. Owners of itchy dogs treated with Apoquel reported a significant decrease in itching 24 hours after giving Apoquel.
So, I hope you enjoy. Apoquel is acting very fast and is really effective. It controls pruritus not only in canine atopic dermatitis but in all allergic dermatitis in dogs. We use a dosage of 0.4 and 0.6 milligram a kilo, and I decide if it's 0.4 or 0.6 just according to the weight, because we have 3 sites of Apoquel, the 3.6, the 5.4 and the 60 milligram. It should be given twice daily in the first 2 weeks, because as I said, there is a huge amount of this inflammatory mediator to turn off. Of course, if you have a dog that is just gently licking the paws, you can maybe try already just 1 per day. Yeah? Then you taper and you pass to 1 daily for maintenance. Apoquel you can give with food or without food, is not important, and you can give with all other treatment. There is not interaction. You don't use Apoquel, at least is what is written in the notice, in dogs that are younger than 12 months or in those that they have a serious infection. You cannot use in breeding, pregnant and lactating dogs. We don't have enough studies. And there are very, very few side effects. And anyway, in this study, there was no difference with the placebo. Concerning the monitoring, this is still not completely clear. What I suggest is, anyway, when you see a dog for the first time, do the baseline of their, do the first blood check, because then you will start maybe cortisone and other therapy, and the blood value will be changed. So I test in the beginning before giving any treatment, and then I use to test Apoquel every 6 to 12 months if they are, in the beginning maybe after 1 month, then after 6 to 12 months just to monitor for leukopenia and the transaminase, because this can anyway change a little bit. What I do is to do the blood sampling more often when I give Apoquel twice daily for long term. Indeed, Apoquel works well daily in the majority of dogs, but in some cases the once daily dosing is not sufficient to control the clinical signs. So we are obliged to continue long term twice daily. And there is a study, is a recent Italian study that showed that the continuing giving 2 times daily these drugs in 53 atopic dog was well tolerated and was effective in the most of the dogs. And during this study, dogs experienced pyoderma, gastrointestinal signs, otitis externa, and they had a slightly decrease of leukocytes, neutrophil, eosinophils, and monocyte count, but these were all the time within range. They also have hypercholesterolemia. So if I give twice a day for long term, I prefer to check their blood. And a new study also showed that Apoquel doesn't cause urine problems. Here a clinical case. I put some clinical cases to show you how I use these drugs. So this is a Gaudi, is a 4-year-old Shih Tzu that came to me with a mild pruritus that started 1 year ago. It's not seasonal, and it involves ear, paws, and perianal area. Here you can see that is scratching. The ears have erythema, and he has a mild alopecia here, and the skin start becoming hyperpigmented. So we performed the cytology on the groin, and there were rare malassezia. We did the cytology in the ear canal that was negative. We used the combo test to see if there were any fluid dirt. And as a diagnosis, we found that the dog had mild malassezia, dermatitis, and possibly also an allergy. And in this case, since it was not seasonal, we took in consideration flea bite hypersensitivity. We have fleas all year in Europe, food allergy, and atopic dermatitis. So this dog has malassezia. How we can treat malassezia, and we can provide immediate itch relief. So what I did is that I give 1 per month Simparica, for example. In the meantime, he had malassezia, but it was not so much, so I give a chlorhexidine 4% shampoo 2 times per week for 4 weeks, and then I associate Apoquel, but only for 3 weeks. Why? Because I want to be sure that the pruritus that the dog was experienced was caused by the allergy and not just by the malassezia. So after 3 weeks, the malassezia should be gone, and we would be able to see a relapse caused mainly by the allergy. So after 1 month, Gaudi improved, but as soon as we stop Apoquel, he started to scratch and lick again. So our diagnosis was of allergy. Since he is still itchy after giving the antiparasitic therapy, we also have ruled out other parasitosis such as Sarcoptic mange and flea bite allergy. So now we have two differential. We are sure that is allergy, but we don't know if it's food or if it's atopic dermatitis. Of course, if we check the probability that has one or the other one, atopic dermatitis is much more likely because we think that is about 80% of the atopic dermatitis, 20% of food allergy, but we have to rule out food allergy. So what we did is to start the workup for food allergy. We gave a homemade diet with a rabbit and sweet potatoes and quinoa for 2 months. And we use Apoquel, which I found a great choice to use during the food trial because it stopped to work when I stop, and it's easy to see if when I stop the drugs the pruritus come back. Imagine that you give a cyclosporine. Cyclosporine takes 2 weeks to start and 2 weeks to see an effect when you stop, when it stops functioning. So it's not a nice therapy to use for a really short time. So let's see what I did. So we continue anyway the flea control. We gave the elimination diet for 8 weeks. And for the first 6 weeks, we gave Apoquel, as I said in the beginning, 2 times per day for 2 weeks, and then Tapert once daily for the other 4 weeks. And then we recheck at 8 weeks. After 2 months, he experienced again a relapse when Apoquel was discontinued. So our diagnosis was atopic dermatitis. So what to do now? So we did the environmental allergy testing. It was positive to house dust mites and also storage mites. So we ordered a sublingual desensitization, and we add oclacitinib in the first 4 or 5 months of immunotherapy, and then we asked to the owner to taper. Why 4 or 5 months? Because the immunotherapy it doesn't work in the beginning. We need to stimulate the immune system. We have to show the allergen to the immune system for a quite a long time before that it starts to develop a tolerance against this allergen. So in the beginning, you have to help the dogs giving a probability control treatment. And here, this is Gaudi after 5 months, and as you can see, it was very good without Apoquel. And so we decided to stop Apoquel and to continue with this desensitization. Here is another case. It's Sunny. It's a 2 years old male golden retriever, and he bites the flanks violently. So the first episode started in the same season last year. So remember when you take the anamnesis to ask if it's seasonal. Because if it's seasonal, you don't take in consideration, for example, food allergy, which is all year round allergy. So this dog received chlorhexidine 1 daily for 10 days, and also Elizabeth collar, and there was an improvement, but the dog was still itchy. He didn't receive any flea control. So our differential were parasitic diseases such as fleas, skin infection, flea bite allergy, and seasonal allergy. We performed as a complementary exam the combo test, which was negative, the skin scrapie, both deep and superficial, because as you can see here, there is a focal alopecia. So anyway, even is normally not itchy, I would also take in consideration Demodex. We performed cytology and was negative. The dog already received chlorhexidine. So what to do now? So what we did is again flea control every month, and we gave Apoquel for the first 3 weeks. We want to be sure that was or wasn't a flea bite allergy or some fleas that I didn't see during my test. And we checked the dog after 4 weeks. The itching was under control completely with the oclacitinib, but it relapsed as soon as it was discontinued. So our diagnosis was a seasonal atopic dermatitis. The owner wants to perform anyway the allergic test. Normally when it's just seasonal, I really don't push for that, but it was positive for pollens and mites. For this time, we didn't recommend the desensibilization, but we asked just to continue Apoquel until the end of the season. But we also said to monitor for winter relapses. And in case of no relapse in the winter, we asked to continue to start again Apoquel in the next season. So, which are the benefits of Apoquel? Apoquel is effective, like steroids. It's easy to administer, and above all, we have then this daily dosing, which is not bad in dogs. There is a quick onset of action. There are no drug interaction. It's safe, and it's a target therapy for prurite associated with the canine atopic dermatitis. How do I use Apoquel? For the short-term control of pruritus, as we saw, which is associated with acute allergy dermatitis, we can use during the diagnostic workup. We can use for flares of allergic dermatitis. We can use in any allergies. We can use also for the long-term control of atopic dermatitis as sole therapy or in association with other therapy. And this is the second video that I let you see about the other new therapy.
Interleukin-31 is released upon antigen presentation to the lymphocyte. Interleukin-31 is a cytokine that plays a key role in the itch-scratch cycle in allergic and atopic dogs. Interleukin-31 is released from T cells and binds to specific receptors on neuronal cell surfaces, which causes the activation of intracellular enzymes. This process triggers the generation of a nerve signal that travels to the brain and ultimately leads to the perception of itch, which results in pruritic behaviors. As part of normal response to disease, plasma cells produce antibodies to block the activity of different antigens. Using the same principles, antibodies can now be administered by injection and used therapeutically in dogs. Monoclonal antibody therapy mimics the natural response to disease by providing highly selective antibodies that specifically target and neutralize only the molecules that are involved in the disease process.
These are monoclonal antibodies, means that all molecules are identical to each other. We have a 93% that is identical to physiological dog antibody. This is important. You cannot use in cat this therapy. The minimum recommended dose is between 1 and 2 milligram kilo. This is, has to be done subcutaneously once monthly. There are 4 different formats. We have the 10, the 20, the 30, the 30. And as you can see in this table, you can see that, for example, for the 10 is between the 3 and 10 kilo of dogs. You should keep in the fridge. This is very important. You cannot give this drug to the owner to do it at home. If you have, for example, a 60 kilo dogs, you can combine 2 different formats, the 20 and the 40. And you do in the same syringe. You should repeat the treatment when the pruritus come back, so normally is after 4 or 5 weeks. And there is a rapid onset of action. Improvement of pruritus is seen in 20 to 48 hours. There is a long duration effect. which lasts, as we said, more than 4 weeks. The return of clinical signs is normally gradual. It's interesting that although most dogs achieve treatment success after a single injection of Cytopoint, some dogs require 2 or 3 injections to achieve full benefit. So if you are not completely happy about the result that you obtain with the first injection, just wait to see what you can reach after the second, the third, 1 month later. Is effective, as I said, in between 75 and 80% of dogs. And those who respond less to clasitinib will probably respond also less to lokivetmab because the effector pathway is similar. It seems to be effective as a cyclosporine, but is faster in controlling itch and lesion in dogs with atopic dermatitis. We have very, very few side effects. We can have lethargy, sometimes vomiting, inoculation pain. There are no contraindications. The only thing, remember, is canonized, so don't use in cat. There are not interactions. The key benefit of Cytopoint is that it's easy to administrate. It improves the compliance. There is a rapid onset, long duration of action, no drug interaction, and can be used even with a concurrent disease. It does not influence allergy intradermal test and also serology test. It's safe, and like Apoquel is a target therapy. Here an example. This is Mario. Is a 4 years male natured pincher. Is itchy from April to May, and he has already been scratching and licking in this period for 3 years. He has not a lesion except for a mild interdigital and moderate pinna erythema. Cytology, skin scraping combo tests are all negative. There are no visible parasites, and is regular treated with sarolaner. Here, the diagnosis is quite easy. Is a seasonal atopic dermatitis. We choose as a treatment Cortavan spray. 1 spray morning and evening on the pose for 14 days. In the moment that he has a flare, and then at least we suggest to continue only Saturday and Sunday. We also ask to put 0.4 ml in the ear canal on Saturday and Sunday to protect the ear from otitis. And the owner reported during the follow-up that it was kind of difficult in this small dog to do the administration of Cortavans. In the beginning, he could do it, but then the dog didn't allow her. So she came back to ask another treatment, and that's why we propose lokivetmab, 1 injection per month. And then the dog responded well to this treatment, and we suggested to do also in the next years, since it was seasonal. This is Tommy, he's 7 months male Italian Greyhound. He experienced 1 month of pruritus on the back, as you can see in this picture. Also during our examination, he was trying to bite himself. So we perform a cytology, skin scraping test, microscopical examination of the coat and of the coat brushing material. Everything was negative. I gave sarolaner to rule out scabies and fleas. And this dog was just 7 months. We saw that Apoquel cannot be given in dogs that are younger than 12 months. So what can we use in this puppy? So I use Cytopoint. Cytopoint you can give in a younger animal, 1 injection subcutaneously, 1 per month. And since, as you can see, it was really severe during the examination, we associate also cortisone 0.51 milligram kilo 1 per day during the first few days to decrease that inflammation, and it was very good. when can we use Cytopoint during the management of canine atopic dermatitis? In the short season atopic dermatitis, when the animals are very young, when drugs are difficult to be given to the animal, and when we have atopy with a concurrent disease, where maybe we cannot use cortisone, and for refractory atopy during the allergy workup, and also when we are preparing the animal for allergen testing, or during also the build-up of allergen vaccine. Here is an example of another animal where I use, in this case, Atopica, or Ichmune, here is called like that, is the cyclosporin. It's a Mao, is a 3 years female natural French bulldog. She had 1 year history of non-seasonal pruritus on the paws, face and ventral area, experienced recurrent secondary bacterial skin infections, and she does not respond to oclacitinib. They use 0.4 milligram once daily, and they already tried also Cytopoint, and Cytopoint was not effective. She does respond to cortisone, 1 milligram kilo one daily, but when they tap her to every other day, start to experience again some clinical signs. The dog is still on barf with the horse meat exclusive, and he never ate before this horse. He was regular treated with Bravecto once every 3 months. Here is the dog. As you can see, it experiences erythema and excoriation on the belly. He has also brown discolorization of the paws, indicating that the dog was licking the paws, all 4 paws actually. And here is a detail of that I already showed you. So the problem list is non-seasonal itching, erythema, abdomen, paws with excoriation. We perform a cytology, and we found bacteria, but without neutrophils on the abdomen and malassezia on the paws. We performed the superficial skin scraping, which was negative. So the dog has this itchy erythematous dermatitis with bacterial overgrowth and malassezia dermatitis. So how can we treat malassezia and bacterial overgrowth and provide immediate itch relief? So we know that the dog didn't respond to Apoquel seed. It didn't respond also to Cytopoint. So what we use is Apoquel twice daily, and we associate itraconazole 5 milligram kilo once daily for 3 weeks to treat malassezia dermatitis, and we associate also topical therapies such as chlorhexidine 4% shampoo twice per week for 3 weeks, and in the days that we were not doing the shampoo, I had a spray containing chlorhexidine 4%. There is a study that showed that has similar efficacy to antibiotic treatment, and in this dog we don't need absolutely an antibiotic, because I said that there was not infection, there were not neutrophil phagocytating bacteria, so it was only bacterial overgrowth. So at the follow-up, 3 weeks later, the dog was doing better, and but it was still itching. So we performed plasma and urine biochemistry, and we had cyclosporin, and we asked to continue for the first 2 weeks Apoquel twice daily, because we didn't want a severe relapse. And after 2 weeks, normally the cyclosporin should start working. So we asked to try to taper seed the Apoquel. And Apoquel was discontinued 3 weeks later, so 1 week before our checkup. And what we found out is that there were no relapse after reducing discontinuing Apoquel, so the dog can continue the cyclosporin once daily and then every month try to decrease. Let's see ICMune, cyclosporin. It's a calcineurin inhibitor. Is an immunomodulatory drug. It inhibits the T lymphocyte by decreasing the production of cytokines such as interleukin 2. It treats chronic inflammatory and immunomediated disease. Be careful when you give this treatment that you take in consideration that it can have several drug interactions that can or decrease or increase the oral absorption of this drug. It's a powerful anti-inflammatory. It prevents the activation of the inflammatory cells. The efficacy is similar to cortisone. You should give 5 mg/kg once daily on an empty stomach. We have the oral liquid or capsule, and the response are slow. So don't give up if after 2 weeks the dog is still itching. You may need also to continue 1 month, 1 month and a half, sometime before seeing the effect. So when you decide to start cyclosporin, try at least 2 months. The efficacy is comparable to cortisone after 6 weeks. The action, as I said, is very slow. It is better to combine in the beginning with the drugs that are faster, such as cortisone or clasitinib. There is a study that showed that there are not more side effects if you combine those. On the contrary, you can have less gastrointestinal problems when you associate it with the cortisone. The recommended, so you start with 5 mg/kg every day, but but after 1 month you can try to taper. You can try taper to half dosage, or what I do normally is to pass to every other day. There are between 36 and 50% of dogs that can pass to every other day therapy, 28% twice weekly, and 25-30% that unfortunately needs to take this every day. There are side effects. Side effects are gastrointestinal signs, but these are just in the first weeks most of the time, but you have to monitor them. These are up to 80% of cases. You can have a secondary infection that can be skin or urinary. You can have weight loss. This is rare, but can happen, and it can happen even quite quickly. So I suggest to weigh the dog every week. And if they lose more than 1-2 kilos in 1 week, I taper to every other day. Papillomas can be also associated, gingival hyperplasia, hypertrichosis, which is not a big problem in a dog, maybe in a human, yes. It can give slight increase of blood glucose, and it is better don't give in diabetic animals, and avoid with tumors. Here is a dog that was receiving cyclosporin. He had on cyclosporin quite severe pyoderma, as you can see in these cytologies. Here you can see the dog had multifocal alopecia. These were collarette that were secondary to skin infection, and when I performed the cytology, I saw several neutrophils which were containing bacterial. So the dog has a secondary pyoderma because of the cyclosporin, and he also had this nice lesion of the inner part of the pinna. As you can see, like proliferation of the skin hyperkeratosis. This is well-known disease that has been reported associated with the cyclosporin, which is called psoriasiform lichenoid-like dermatosis. And cyclosporin can induce a generalized hyperkeratosis as well. And these are lesions that when you stop or decrease the cyclosporin, they normally improve alone, as you can see in this dog. This is the gingival hyperplasia, and also this one, like sometime improve alone, or if you need really to continue the treatment, you can associate azithromycin, which is an antibiotic that show to improve these lesions. And in the last 10 slides, we saw how to properly react to flare, how to extinguish the fire that atopic dermatitis can give to our dogs, and how to give a long-term control of the itch and the clinical relapses. The innovative long-term treatment strategies are now targeting flare prevention, not treatment, prevention, and the skin barrier stabilization. The new approach is based on the fact that the normal-looking non-lesional skin of atopic dermatitis is immunobiologically not normal, but it characterized by invisible inflammation and barrier defect. So this has led to a novel concept that we should use this proactive therapy, which is defined as a long-term, low-dose, intermittent dose application of an anti-inflammatory therapy to the previously affected skin. So even if you don't see anymore the lesion, but you know that that area had a lesion, you should continue to treat over time this area to prevent relapse. And you should also associate ongoing emollient treatment and support both topical and orally the skin barrier. So this means that once the patient has remained clear of clinical signs for several weeks with the drugs that we saw now, we can start the so-called phase 2 proactive therapy. And sorry, I'm running late. So we can start the use, for example, hydrocortisone saponate. Hydrocortisone saponate is a cortisone that causes limited skin atrophy and systemic absorption. It may anyway interfere a bit with the skin test, so it's better to stop 2 weeks before doing the skin test. There is efficacy which is comparable to cyclosporin, and it improves also skin barrier function. So the proactive therapy means that for 2 consecutive days per week, for example, every Saturday and every Sunday, you apply Cortavans on the skin where there were the lesion, and also you can instill into the ears Saturday and Sunday to prevent relapse of skin lesion and otitis. And then we have also tacrolimus that we can use with the same idea of hydrocortisone saponate, which is a calcineurin inhibitor. It's quite expensive, but if the lesions are just a few and smaller, you can use. It's safe, and you can put daily on a lesion, and when you have, and then you can put also Sunday and Saturday. As we said, there is not only the inflammation to keep under control, but also the skin abnormalities. It is not still clear if these are causes of consequences of the canine atopic dermatitis. We do know that there are structural defects in lipids. we know that the intracellular lipids are disorganized and they present larger intracellular spaces. There are decreased and impaired concentration of ceramide and sphingosine in the skin, and there are also abnormality in the proteins like filaggrin, and filaggrin expression in some dogs is lower, and there is also the lower expression of claudin 1, which is an important tight junction that help to keep very tight the cells and avoid the passage of allergens. There are also functional problems in the skin barrier. Indeed, we have a higher transepidermal water loss, and it has been shown that when we treat the atopic dermatitis, this improves. So we need to add moisturizing to the skin, and this has been shown that it helps to decrease this loss of water and to increase the thickness of the stratum corneum and decrease the inflammation. There is this study that showed that Hermidra was effective in canoid atopic dermatitis to decrease signs. And we can use also skin barrier restoratives such as topicals. We can use Ophitrium, which is a plant derivative which help to decrease the pro-inflammatory cytokines that are released by T helper 2 cells, and help also to restore barrier function. We can use fatty acid. We know now that they have an anti-inflammatory and antipruritic function. They also improve the quality of the fur and the skin. And we can use sphingolipids. We saw yesterday, for example, atopy vet collar with the biosphin was effective in dogs with atopic dermatitis, and also ceramide as well, indeed. We can also use not just a product to add on the skin, but also food. There are plenty of studies that suggest the efficacy of these diets, which are integrated, supplemented with fatty acid and skin barrier restoratives. Last, for example, we have this article. Is an article that shows that a novel diet that has been presented today, the skin topic, is a diet that has been supplemented with the turmeric and licorice extracts, and also the amount of omega-3 and 6 have been incremented in the increase in this diet, and has been shown in this article that this diet increases skin barrier function in dog with atopic dermatitis, showing a good result in decreasing the pruritus and decrease the needs of drug in dogs with atopic dermatitis. Last, we have the etiological treatment, allergen-specific immunotherapy, to know that is the only available etiological treatment for canine atopic dermatitis. Its efficacy is between 50-70% depending on the study that has been published, and allergens are selected based on the history and positive test result, so we can do with the intradermal test or serological test, and there are 3 types of allergen-specific immunotherapy that has been tested and that are using now for dogs. Subcutaneous, which means by injection. There is a protocol that you have to follow with an induction phase, and then where the injection are more often, and then we arrive to a maintenance injection 1 per month. And then we have the sublingual, which can be convenient for some owner that they do not like the injection, but on the contrary, it's morning and evening, twice daily, the administration of 1 drop or 2 drops in the mouth. So it can be challenging for people that are quite busy. And last, we have the new intralymphatic immunotherapy, which means that you inject directly in the lymph node this solution, and then and this avoid the need to use the induction phase. So you stimulate immediately, you give immediately directly in the lymph node the allergens. In this way they are directly in contact with the lymphocyte, and this boosts the response. And then you can continue with the subcutaneous 1 per month. Sorry. The intralymphatic is safe and equal in efficacy to the subcutaneous. The response to treatment may occur more quickly than the subcutaneous, and even though the sublingual is safer than the subcutaneous one, and it is more practical, unfortunately it seems to be the less effective. So following the result of this study, the intralymphatic seems to be the more effective one. Just to summarize, when you control dogs with atopic dermatitis, you need first control the secondary infection. Be sure that at any time you have this under control, because they may be just the explanation that your drug is not effective anymore. Treat and prevent each, and improve the skin barrier, and if possible, do the immunotherapy, please. So thank you very much. I think we are running out of time, but if you have few questions.
So, we start a bit late, Indian time, right?
I want you yesterday.
So, Indian time. Okay, so we are back to cats. You remember, I will only speak about cats. So, we talked in the first lecture regarding all the reasons why cats have pruritus. Now, we should try to understand the diagnosis, right? And in order to get the best diagnosis in the shortest time, we need to have a very systematic approach. So, in fact, we have seen in my previous lecture that pruritus is caused by parasites, by allergies, and by infections, because also the bacteria and the malassezia, they give pruritus. How do we proceed? So first of all, we are going to check and treat the parasitic infections. Then we are going to check and treat the bacterial and malassezia infections. And after that, we are going to check food allergy. And this is going to be the main topic of this lecture. So very easy for the parasites. As we have mentioned before, we can give isoxazolines. And so we have fluralaner, lotilaner, sarolaner, and also now we have azafoxalaner, NexGard for cats, Bravecto, Simparica, Credelio. I do not know if the names are the same here. Yes. Same, okay. We also have macrocyclic lactones, like selamectin, Revolution. It is stronghold in Italy, Revolution here. Moxidectin, imidacloprid, this is Advocate. and eprinobacter, fipronil, esmetoprenate, this is broadline. They will all be best to eliminate the parasites from cats. So once we have done this, as we have seen before, we check for infections, we do impression smear cytology for bacteria and for malassezia. And you see bacteria, we have seen them in the neutrophils. These are cocci. This is malassezia. They are like footprints. We usually use the sticky tape to check for malassezia. I do not know if yesterday you have also used the sticky tape. Dr. Nagajaran is not here anymore. Yes, you did? Okay. So you know how it looks like. And then in cats, remember that we also have dermatophytosis. And I told you that sometimes miliary dermatitis may mimic dermatophytosis or vice versa. Dermatophytosis may mimic miliary dermatitis. Sometimes you have lesions of crusts on the face. They may be pruritic, and that can be caused by dermatophytosis and not by allergy. So a Woods lamp examination, a fungal culture, and then you put this hyphae under the microscope and you see the typical kayak-shaped. You have kayaks? Yes? Okay. Kayak-shaped. Maybe you have these traditional kayaks. Boats, yes. Would be interesting to see them. Okay, we don't have traditional kayaks in Italy. And they look like boats. And then, after having eliminated the parasites, after having eliminated the infections, we are going to concentrate on diagnosing food allergy. And that is not so easy. Before telling you how to diagnose food allergy, I would like to tell you a couple of words regarding what is food allergy, particularly in cats. So this is going to be dedicated to the cat. So there is a series of articles that are open access, and they are 9 now, dedicated to food allergy in animals. It is called Critically Appraised Topic, and the acronym is CAT, and I like it because it's cat. But it's not only for cats, it's also for dogs. So Critically Appraised Topic on adverse food reactions, and you find them on the internet. There are 9. And each article is checking one aspect of food allergy. And number 3 was checking the prevalence of food allergy. So what do? They analyze all the literature on this particular question, how common is food allergy, and they try to summarize what has been published for each question related to food allergy. So here, from all cats that are brought to the clinic, food allergic were 0.2%, so very small amount. But maybe cats are brought to the clinic for many other reasons, for kidney disease, for example, not only for dermatology. From the cats that have pruritus is up to 20% are food allergic. What I said before, I think that 1/3, in my opinion, 1/3 of the cats that are pruritic, that have allergy, can have food allergy. Now, what about the signalement, so age and sex? It can occur at every age, from a few months to 15 years of age. What I said before is if you have an animal that was perfect until 9 years of age and then starts to have pruritus, think of food allergy. That's more probable than atopic dermatitis. The average for developing food allergy is about 4 years. That is much older than in dogs. Elisa will tell you about food allergy in dogs later, and you will see that it occurs earlier in dogs. In cats, not so. Could we close the... Okay. Only 9% of the cats with food allergy develop it before 6 months of age, and about 23% develops it before 12 months of age. And this is much older than in dogs. And the female to male ratio is 1.5, but this is not statistically significant. Now, there are very few cases that describe breed in food allergy. So it has been described in 5% were Persian cats, 4% were Siamese, and 2% were Burmese, but I don't think that we can make any statistics, because how many breed cats do you see compared to domestic short-hair cats? I don't see many breed cats. They are usually cats. Now, we call them European short-hair. Do you call them Indian short-hair? Domestic short-hair, okay. So we don't have a lot of breeds, no. At least not in Italy. Do you have lots of breed cats? Huh? Persians. Of the breed cats. But of all cats, how many are breed cats and how many are? Mostly are normal cats, okay. So I think this statistics has not so big significance. Now, most importantly, what are cats allergic to? In Italy, everybody says, oh, it's chicken. Chicken is the mother of all problems. But when you look here, you see, they are allergic to bovine meat more than chicken. And of course fish, because cats eat a lot of fish. But be careful, this is the information from all articles of the world combined. So it really depends on what your cats eat. What do your cats eat as the main protein source? Chicken. So, and fish. You don't eat bovine. Okay, so most probably this will be very low in India, while chicken will be much higher in India. Yes, and you should make a study to check in India how the situation is. So you see, and then we have dairy products, and then we have vegetables like corn and wheat. And again, what do you eat most? You eat most rice, probably, and lentils, right? So that could also be. Okay, now regarding the clinical presentation, we have already seen how cats manifest their pruritus. Generalized, very frequent, but with food allergy we have already seen particularly the face, and mostly they scratch and lick, and this is what we saw before. This, for those of you that were sleeping in the first lecture, maybe. Here you have the manifestations of allergy in cats, self-induced alopecia, scratching and excoriations of the head and neck, that is more typical of food allergy, miliary dermatitis with small crusts, eosinophilic plaque, particularly on the abdomen, eosinophilic granuloma, remember to check always the palate, and indolent ulcus. So very typical manifestations of allergy. But we are talking about food allergy, and food goes through the intestinal tract. So we also often have intestinal signs. How frequent are these? Well, it is very difficult to tell you, because it will depend if the author of an article is a dermatologist or if an author of an article is a gastroenterologist. Because of course, if it is a dermatologist, he may see lots of skin problems with very few gastrointestinal problems. But if it is a gastroenterologist, he will see a lot of gastrointestinal problems with few skin problems. And you can see here, if the authors are dermatologists, only skin 77%, and skin and gastrointestinal problems 20%, which probably is the truth. Because if the authors are gastroenterologists, then you see more gastroenteric problems. But about maybe 1/4 of the cats also have gastrointestinal problems. And what are these gastrointestinal problems? Well, diarrhea and vomiting. In dogs is mostly diarrhea. In cats there is also a lot of vomiting. Cats vomit very, very frequently. Interestingly, we also may have conjunctivitis associated to skin problems, as well as sialorrhea, while rhinitis is not so frequent. Okay, So I have presented you a little bit how food allergy looks like in cats, and now how do we diagnose it. And we have a big problem with cats because they are fuzzy, they are picky, and you cannot starve a cat. I mean, a dog, you put them the food there, if he doesn't eat 1 day, 2 days, the third day he will eat. The cat, if the cat doesn't eat 1 day, the second day the cat must eat because you risk hepatic lipidosis. That is a big problem. So you cannot leave starving a cat. The cat must eat nearly every day, otherwise you risk hepatic lipidosis in some cats. And so let us see how do we diagnose food allergy at the best. So what I said in the first lecture, serum tests are not good for the diagnosis of food allergy. We really throw away the money of our owners. Why is that so? Because some cats, they may have a type 1 immediate IgE-mediated reaction, and these IgEs are the antibodies that I measure in my serum test, but many other animals will not have this IgE-mediated reaction. They will have the cellular-mediated reaction, and these cats will not be identified by the serum test. This is the first reason. The second reason is that there are many cats that are atopic, that can have positive food allergy tests. There are many cats that are completely healthy, that are not allergic. They also can have positive food allergy tests. So really we cannot differentiate between healthy and food allergic cats, between food allergic and environmentally allergic cats by a serum test. This is not possible. And the same is true with the environmental serum test. It cannot differentiate between healthy and atopic dogs or cats. You should not use serum test for the diagnosis of an allergy. So the accuracy that has been calculated is about 20%, extremely low. So the positive predictability is 0%. So if the test is positive, what is the chance that the cat is allergic to that particular ingredient? 0. The negative predictability, if the test is negative, for example, to fish, what is the chance that the cat is really not allergic to fish? 20%. You see, they are not reliable at all. And the problems can be the identification of the allergen also. For example, we have fish, raw fish, that has particular proteins. This raw fish is cooked and the proteins change their conformation. It is processed to make a commercial kibbles, for example, and again the protein conformation can change. And then this food is eaten, is digested, and again the protein conformation is changed. So that from the original fresh fish to the protein that is recognized by the immune system in the intestinal tract, it can be a very big difference. And so what do we test? We don't know. It's difficult. So another problem is that there are many cross-reactivities. For example, the main protein that is recognized in mussels, our animals eat mussels, right? Mussels. Is tropomyosin. Tropomyosin is an allergen. Did you know that tropomyosin is very well conserved among the species, from the fleas to the house dust mites to the, fish, the frogs, the reptiles, the mammals, the birds? Tropomyosin is very similar in all of these animals. So if I test, for example, for fish, and it is positive, maybe my cat has never eaten fish. Why is it positive? because the cat is allergic to chicken, and there is a cross-reaction between fish and chicken. So we cannot rely this test also because of the problem of cross-reaction. We don't know very much about cross-reactions in cats. We have information about cross-reactions in dogs between fish and chicken. And that is important. We can think that maybe in cats it is the same. So, in fact, maybe the only test that can be reliable, but this test is not commercially available, you may have it in some universities, is the lymphocyte stimulation test. And this has a positive predictability of 100% and a negative predictability of 50%. So we harvest the lymphocytes from our allergic cats, and we put the lymphocyte in contact with the food. If these get activated, then the animal is allergic. If the lymphocytes are not activated, then the animal is not allergic. And Elisa can tell you very much about this because she has done her PhD thesis on this, about food allergens. But in dogs, you should have done it in cats. Okay, and I do not know if you have this Feli-Dial test. It is a Western blot that was used to check and choose the best diet that you can give as an hypoallergenic diet. So we have made some studies about Chino-Dial, and the reliability was acceptable. Okay, so now I am very slowly drifting to the concept of you need to make a diet to diagnose food allergy. And there is no other possibility. Would you please close the door? Yes, thank you. So the only reliable way to diagnose food allergy in cats is to make a diet. How long should this diet be? 8 weeks maybe is a good compromise. If you want to do it extra well, then 10 weeks, but certainly not less than 8 weeks. Because if you do it for 5 weeks, you will only diagnose 60% of the food allergic cats. If you do it 5 weeks, you miss 40% of your diagnosis. If you do it 8 weeks, you will diagnose 92%, and 10 weeks, 95%. So now the point is, which diet should you choose? Do you want to give it home-cooked or commercial? How many of your cats eat home-cooked diet? Many or? Many? How much?
40%.
40%, okay. So, if you...
That is Bombay.
Eh?
That is only in Mumbai.
In Mumbai, 40%. In the rest of the country? 60%. They eat homemade food. Okay. So this may be a big problem, I tell you why. So it is true that if you feed a cat, for example, with horse meat, do you have horse meat? No. What do you use for your allergic diet? Chicken? No. Rabbit? Duck? Okay. Duck and pork, but not for Muslim cats. Okay, Muslim only use duck. Okay. Yes. Yes, because Muslims don't like dogs, right? Is there any Muslim here that can confirm?
Yes, that's
Yes, okay, they don't like dogs, okay. Well, I like Muslims then. I like... I'm sorry. I'm a cat person. Okay, anyway. Now, there are some cats that can eat duck without a reaction, food allergic cats. But if they eat a duck-based commercial food, they will react. And that is maybe because in this commercial food there is much more than duck. There are preservatives, there are colorings, there are additives, there are flavors, and so the cat can react. So that is the reason why we want to eat homemade food, because this is pure, right? The ingredient that you give is in the table. On the other hand, it can be quite difficult to compound a well-balanced diet with few ingredients, because you cannot just give duck for the rest of the cat's life. I mean, you will miss a lot of things, minerals, vitamins, amino acids like taurine and so. So usually you need at least 6 ingredients to make a well-balanced diet. And the more ingredients you give, the more you risk that the cat will react to one of these ingredients. And then if you give a recipe like it has to take 103 grams of duck and 57 grams of rice, you know, it can be very complicated. And the people with time, they will stop doing it. It is called diet drift. And what happens is that about 13% of the owners only will follow the prescription. Only 13%. The majority will just give something else. So that is why, at least to make the diagnosis, we would rather prefer a commercial diet. But which commercial diet? You know the limited antigen diets where you have duck and rice, for example. Or maybe the cat has already eaten rice, you give duck and corn. Now the problem with limited antigen diets is that they may be contaminated. There are several studies, and these are just some of the studies, that have analyzed by PCR the protein origin that was in the food. Now the first 2 studies were done with normal food that you buy in the shop. So the food was written, it is with chicken and rice, and there they not only found chicken, but other protein sources. Which, if the cat is healthy, it's not a big problem. But if you want to buy a special limited antigen diet for the hypoallergenic diet trial, and this is the last 2 studies, these were feeds that were sold as limited antigen, so for hypoallergenic diet trials. And even in these, 10 of the 12 elimination diets were contaminated with other proteins that were not declared on the label. And here, 9 out of 12 were contaminated with other proteins undeclared on the label. This is scary. I think this is really scary. It's like you cannot really trust the content, even if it is a limited antigen diet. The point is that we do not know if the amount of proteins that has been found is significant to elicit a reaction by the cat. We don't know, but we have to pay attention. So what I do to make the diagnosis, my best choice is a hydrolyzed diet. And this must be really hydrolyzed. The dimension should be maximum 6 kilodalton, not more than that. Otherwise, it will be recognized by the immune system. What is a hydrolyzed diet? You see here the protein, long protein. It is cut in pieces. These are small peptides or just amino acids. And these pieces must be ideally smaller than 5 to 6 kilodalton. Okay? Why is this good? Because these pieces are so small that are not recognized by the immune system. So this is a mast cell. You will remember that if an antigen binds to the IgEs on the surface of the mast cell, in order for the mast cell to degranulate, it has to make a cross-linking. So it has to bind 2 molecules of IgE on the surface. But if the molecule is too small, it is not able to make the cross-linking, and so the mast cell will not degranulate and the reaction will not start. Remember that in diets we have a protein source, and this is what I'm talking about. We also have a carbohydrate source. For example, there is rice, there is corn, there is wheat. But as you know, in these carbohydrates, there is also a protein amount. For example, in wheat, we may have between 9 and 13% of proteins. In rice, it is also 9-10% of protein. And you have seen before that cats could also be allergic to rice. Why is that? Because they are allergic to that protein components in the rice. So if we feed a hydrolyzed diet that has a full cereal, one example would be Royal Canin hypoallergenic. The proteins are hydrolyzed, but the cereal, it is whole rice. The cat may react to the proteins in the rice. So what we need is that the carbohydrate component must be starch. So this is a nice study where they took 29 cats that were IgE positive for corn. They were fed, the serum was put in contact with corn flour, and 20 of 29 cats would recognize corn flour. But if they were put in contact with starch, corn starch, no one would recognize corn starch, because the starch is only the carbohydrate part of the cereal. There is no proteins in the starch. So you should take attention that the hydrolysis is a good hydrolysis, and that the carbohydrates is a starch and not a whole cereal. Okay. Now we give the diet in order to confirm the diagnosis of food allergy. We give the diet for 8 weeks, and then we wait for the cat to improve. And after the 8 weeks of diet, the cat comes back, and it is fantastically improved. Okay, well, we are very happy. Do we have the diagnosis of food allergy? No. We only have the diagnosis of food allergy when we give the old diet again, and we see that the cat deteriorates. And ideally, we would then give the hypoallergenic diet again, and we see that the cat improves again. Why is that? There are, and this is a study that we have done with Farmina Ultraipo. This study has been published, so I'm sorry, this is an old slide. The publication has been published. Of 26 cats that have done the diet, 18 cats improved, which is very much. It's nearly 70% of the cats that improve on a diet. This is fantastic, right? So changing the diet would be the first thing we want to do. Of these, one owner didn't want to change the diet. She says, my cat was scratching for years, now it's not scratching anymore, I'm not going to change the diet. And this happens very often. But 17 owners underwent the provocation test, so went back to the old diet, and 9 of 26 relapsed. So in total, 1/3 of the cats that were put on the diet had a food allergy, which is more or less what I would expect. But 8 cats, even if you feed the old diet, they do not relapse. We cannot say that it is a food allergy. We can say that it was the effect of the food on the allergy. For example, we have seen before, there are foods that are rich in omega-6 and omega-3 fatty acids that are rich in substances that will improve the diet. So if you change the diet, and if you give a good diet, maybe the dermatitis will improve just because you have given a good diet. Or you start the diet, for example, when is autumn here? And when does the winter begin? Because now it's summer, right? It's spring in Europe, so when is it starting to get colder? It never gets cold here. In November, okay. So you start the diet, let's say at the end of October. You do the diet for 2 months, 2.5 months, and you get to December, right? Now, it may be that the cat improves because there are no more pollens around. In October, there were pollens. In December, there are no pollens anymore. And if the cat is pollen allergic, it may have improved because the season has changed and not because of the diet. Or, what do I do is, I see a cat that has pruritus, I give Bravecto, and I start the diet on the same day. So maybe the cat is improved because of the antiparasitic drug. It had fleas, it had some other parasites, and not because of the diet. So it is really important that you do the provocation test to confirm that it is a food allergy. Otherwise, maybe you say the owner, yes, it's food allergy. This poor cat is going to eat hypoallergenic food for the rest of its life, and it's not necessary. So it is important to confirm the diet. Okay, now Here we have the main problem with cats, because as I said before, in dogs, you put there the food. No hungry dog will die of starvation with a food bowl, right? Cats will. So really, palatability is a big problem. About only 40% of owners complies with what you prescribe. Palatability in cats is the main problem. Of the hydrolyzed diets for cats that I have tried, Farmina Ultra Hypo is the one with which I have worked quite a lot and has a very good palatability. So I go with that for the first one. And sometimes I have to change. Some cats prefer Royal Canin analergenic, some cats prefer Purina. You have Purina here? Yes. HA is another hydrolyzed diet. Not HA? Okay, that is a pity, because that is another very good hydrolyzed diet. Okay. Another problem is that it is not always possible to keep the cats at home. Maybe they go out and they eat from the food of the neighbor, right? Or maybe they will go out, hunt, and eat mice. Now, here you have to find a compromise, because sometimes if you keep the cat inside at home, the cat will get so frustrated that will start to do psychogenic alopecia, maybe worse than the food allergy. And you have to find a compromise. Maybe tell the neighbors not to leave food outside, and tell the mice to go away. Okay, good. Now, in this study, of 128 cats that were prescribed with an elimination diet, only 70% of the owners accepted to start the diet. So that is not very much. And only 60% could finish the diet for at least 6 weeks. Explaining the owner why making a diet is so important will help a lot. So I would tell the owner, 30% of the cats are food allergic. We may solve this problem just by changing the diet without giving the bad corticosteroids, without giving the bad drugs. Maybe the owners will be convinced. And then I usually recheck the cats after the first month of diet, and I see if the owners are not giving something else besides the diet, because there are lots of things that the owners may give and they are not aware that this will be not good for the diet. For example, antiparasitic products in chewable tablets. When I start a diet that will last 2 or 3 months, I prefer to use spot-ons as an antiparasitic, because these chewable tablets have pork liver as a flavoring. Gelatin capsules. Sometimes we give gelatin capsules containing fatty acids as a supplement for probiotics. This gelatin contains bovine proteins, and so we should not use them. Vitamin and mineral supplements. If you make a home-cooked diet, maybe you will want to add some vitamins and minerals because it's not balanced. But remember that the vitamins and minerals for animals, they very often are appetized. They have appetizers that contain proteins. Cats lick very much because they are allergic. They lick and lick and lick. And so the owners may give this removal, paste for removal of the hair balls, right? Do you have them? Yes. They contain lots of animal proteins because they are palatable, and that is the problem. The owners don't think about it. Probiotics, for example, animals that may have diarrhea or soft feces, they give this lactic acid probiotics. Those for animals, they have appetizers with proteins. And antibiotics, if these animals have secondary bacterial infections that we need to give antibiotics, you should avoid the palatable tablets because they contain animal proteins. Okay, now another problem is that no owner will do 8 weeks of hypoallergenic cat with a cat that is scratching its face off, right? So you have to stop the itching because the cat will be happier, the owner will be happier, and thus the owner will be more compliant. So that is really very important. And we need to give an antipyretic drug at least in the first 6 weeks. We need to stop the antipyretic drug in the last 2 weeks because we want to see the pure effect of the diet. If we continue the antipyretic drug until the end of the diet, we will not understand if the diet is working or not, right? So we have to stop it 2 weeks before. And which drugs can we use? Well, we can use corticosteroids, methylprednisolone or prednisolone at 0.5 or 1 milligram per kilogram every day. You all know that you should not use prednisone in cats because it is not well metabolized. You should use prednisolone or methylprednisolone. And as an alternative, as Elisa mentioned before, you can also use oclacitinib in cats. Where are zoetis people here? Hands up. No zoetis people here? Okay, yes. Zoetis is very clear about the fact that they do not advise the use of oclacitinib in cats. This is not registered and is not advised by zoetis. We do not know very much about the safety of oclacitinib in cats, and I'm going to talk about it later. But if you have a good, healthy cat for a short period of time, like for 6 weeks, you may want to use it. So the dosage is 1 milligram per kilogram every 12 hours. You give it for 6 weeks. Now, the blisters, the boxes come in 20, so you can use just 2 boxes, is 40 days, and it's about 6 weeks. And then you stop the oclacitinib. Cyclosporin has a too long lag time to be useful for this short use of antipyretic drugs. Okay, now your cat has finished the diet, it comes back. And if pruritus has improved or disappeared, as I said before, you have to do the provocation with the old diet as a whole. You may also want to do the provocation with the single ingredients, one by one. It is like a Sherlock Holmes process. And the relapse you would expect could be after a few hours for those cats that are IgE producers, that have an immediate type food allergy, but up to 10, 14 days for those cats that have a cell-mediated slow reaction. So you have to be patient. Every trial should be done for at least 10 to 15 days before you do the next trial. But there may be also owners that come back and say the cat is not improved. Now you have to ask in a very nice way, oh, sorry, it has not improved. So what did you feed to your cat? And the owner is going to say, oh, I fed the diet that you gave me. Oh, very good. And what else did the cat eat? Smiling. And the owner says, oh, a little bit of Parmesan cheese on top, otherwise he would not have eaten it. Okay, well. And what else did the cat eat? Or in the morning, a little bit of biscuit, because he always does breakfast with me. So if you are nice, things will come. If you say, did you do the diet right? They say, yes. He ate nothing else? No. But this is not true. This is not true because the owners, they lie. They lie. So, I'm sorry, we are also owners. We also lie. So, really, if you can estimate that the diet was really done well, then you can say that the cat has not a food allergy. Unless you find fleas, parasites, or infections that would justify the pruritus. But usually, at the end of the diet, they don't have fleas because you have treated them at the beginning with the antiparasitic product. Okay, now, I have another 8 minutes and 41 seconds. I would like to... Okay, yes. 5 minutes. Okay. Yeah, 8 minutes, 25 seconds. So you have found on your chair these leaflets, right? I would like to show you what this is, if you allow me. I just need Kochi. Okay. So this is a web portal, a web page. And this web page is completely dedicated to veterinary dermatology. So if you like veterinary dermatology, you will find there a lot of information. The people that do this, we are 6 board-certified diplomats of the European College of Veterinary Dermatology, and here this is Elisa. Elisa is one of the people that work on this web page. What is interesting for you is here up, you see my it's the reserved area. This is a subscription only area where you have to put your name and subscribe. Only for veterinarians. We don't want to have anything to do with owners. I only want to work with veterinarians. When you get into this reserved area that is subscription only, you can find a lot of information. These are 3 containers with videos. Now videos are very much in fashion. Everything goes through videos. And these are video cases. So every week we put more material. So 2 days ago, I put this video case on a hypertypic Shar-Pei, and here you see we have video cases, and here we have the collection. You can see all the video cases that have already been posted. And they last maybe 10, 15 minutes, so they're short cases, but interesting cases. Then we have videos on tutorials. So it is a little bit to see what you have done yesterday in the practicals. So here is microscopic examination of hairs, removal of ceruminoliths from the ears, and here we add cytology of the ears, deep skin scraping, small videos where you see how to do these procedures in dermatology. This is another container called Wonders Under the Microscope. These are also video cases, but here the diagnosis was achieved by the microscope. So there is cytology, there is histology, there is skin scraping for those people that like a little bit more the microscopy. Then we have a container that is called resources, and here we put a lot of other material. So we have, for example, open access articles, and we have now over 100 articles that you can open, download, and read. And each month we put more articles, usually by topic. We have links to interesting sites. We have articles that we write. Every month we write an article on LinkedIn. And we also take articles from Veterinary Focus of Royal Canin. They give us the permission to publish their articles, and so they are articles on interesting topics. Then we have free books that you can download related to dermatology, but also parasitology, pharmacology. We have about 70 information sheets for owners that you can download and print and give to the owners on diseases, on the drugs, on therapeutical or diagnostic procedures. Then we have, some of you may have taken part in the webinars that we offer every month. If you want to give me your email address, you may be put in a mailing list, and every month we have a completely free webinar, and it is an interactive webinar where the people at home may reply to questions that I ask on the telephone. And then we discuss the questions. It is really nice. These are case presentations, and we record them and we put them here also for those of you that have not participated in the past webinars, you see, you can put yourself to the test with the recording of these webinars. Sometimes we also invite experts. For example, in this case, in the middle, we had Francesco Chan, who is a very important cytologist. He will also come to Gothenburg, to the European Congress that will take place at the end of August in Sweden. And he was talking about pitfalls of skin cytology and of tumors. And so that was really also very interesting and interactive. Then we have a huge atlas with over 500 images. These are both clinical and microscopic images that you can download and use for your clinic, for your owners, for your presentation. They are completely at your disposal, and every month we add more images. Then we have an area called news, and in this area, every 2 weeks we have a post, something new from a congress, from an article, from the human medicine. For example, last week we were at the North American Veterinary Dermatology Forum, and here Roberta has taken a very interesting news from one of the free communications. And so, for example, did you know that cats with wavy whiskers are FELV positive? It's interesting. So if you see a cat with wavy whiskers, you should test FELV. And then last, we also have an agenda in which we put the webinars, the congresses, and the meetings that we know with the link. Here we have the European Congress. There will be a nice master course on autoimmune and immune-mediated skin diseases, and you can get information there. Okay, so when you subscribe to this portal, the subscription is at a very small cost, because of course this is going to cost money to manage. It is less than €5 per month. However, the very first month is completely free. So you can go, subscribe, you can navigate for free for 1 month. If you don't like it, you cancel and nothing will be charged. If you like it, then you will stay and you will be charged for 1 year of navigation, €58. That is all. How do you subscribe? If you get in community, there, community, you scroll down. Well, there is the presentation of everything. You scroll down, at one point you see here subscribe, and you can click here and you subscribe. So if you want to give me your email later, you can come and give me your email. You can be put in a mailing list so that we can tell you when there is the next webinar. Or I usually write to the Indian representatives and you can circulate it. So I hope you will like it, and I'm finished. Okay, thank you.
So, honorable speakers and distinguished veterinarians of the country, a very good afternoon to you. I am Rakesh Mohan, the Executive Director for Scientific Remedies Private Limited, and we are proud to showcase our soon-to-be launched revolutionary product for atopic dermatitis and other skin conditions in this occasion of ICVD. Respected veterinarians, interest that this event has gathered is in itself a strong testimony to the importance of skin, which is the largest organ in the body of dogs, cats, and small animals. Scientific Remedies, Possum Companions, and NextGen Pharma from Switzerland are proud to introduce to you, for the very first time, a revolutionary and proprietary product based on postbiotic metabolites that helps promote ceramides indigenously. I now request Dr. Akhil Prem, our National Vet Affairs Executive, to talk more about the product.
Thank you very much, sir, and a very good afternoon to all the respected leading veterinarians of the country. Skin diseases are a common occurrences in dogs and cats. Most of the vets who are out here would admit that atopic dermatitis would be one case which is very difficult to treat. Why is it so? Historically, most of our treatments were focusing on the abnormal immunological response rather than focusing on the epidermal or skin barrier function. A characteristic feature of atopic dermatitis is that your skin barrier function will be affected, as a result of which there will be increased transepidermal water loss combining with the loss of skin hydration. We all know that ceramides make up about 40 to 50% of the epidermis or the stratum corneum. So in order to protect the epidermis, we need to protect the ceramides. There are two ways of restoring ceramides. Either you can supplement ceramides exogenously or you can provide ceramides endogenously. The major problem with exogenous ceramide supplementation is that the entire spectrum of ceramides cannot be generated. Also, they do not, that means the absorption rate will be very less. But when comparing to the endogenous ceramides, they are actively absorbed, as well as complete spectrum of sphingosine-based derived ceramides can be generated. Currently in the market, no product is there which is having endogenous ceramide-based products. So, what is Forever Ceramide? Forever Ceramide is a proprietary post-biological dermatological product containing high concentration of ceri actives, which produces ceramides endogenously. May I now request our honorable speakers, Meena Madam, Noli Madam, and Dr. Nagaraj Sir, President IVDA, to grace the occasion by unveiling our product. Ladies and gentlemen, presenting before you the first ever endogenously produced ceramide-based products for pets in India. That is Forever Ceramide. Forever Ceramide, by its endogenous action, is able to generate all the relevant sphingomyelin-derived ceramides and restore skin moisture. Forever Ceramide is a complete comprehensive solution for recurring and difficult to treat atopic dermatitis and associated alopecia in dogs. And if you do have other conditions such as parasitic dermatitis, sarcoptic mange conditions, and in any conditions wherein the epidermal skin barrier is affected, you can use our product. If you do have difficult to treat atopic dermatitis, we recommend using our product twice daily for a minimum of 15 days. Ceramide will be available for orders from our authorized distributors across the country within 1 month, and we eagerly await to receive your feedback on the products after having used it. We thank the honorable speakers, Dr. Noli ma'am, Dr. Meena ma'am, and the president of the IAVD, Dr. Nagaraj sir, for unveiling the product, and to each and everyone out here for your time and support. We look forward to your continued support in the coming months and warmly invite all delegates to our scientific remedies stall to discuss more about the product. Thank you. Thank you.
So I was asked by Zoetis to give a lecture on the use of their products for allergic dermatitis in dogs, and that is particularly Apoquel and Cytopoint. Do you have Cytopoint? No. Not yet. It will come. It will change your way of working. It will really change. So we decided to make a small introduction to pruritus because you have already heard it from Elisa. And so the definition of pruritus is this unpleasant sensation that arouses the need to eliminate it with biting, scratching, rubbing, licking. And we have many causes of pruritus. We have seen in cats parasites such as Klebsiella, fleas. This is actually the cat flea that goes on the dog. In dogs we have sarcoptic mange, and as I said, It is easy to find the mange mite in cats, it is very difficult in dogs. And besides the parasites, we also have, like in cats, food allergy, atopic dermatitis, and we also have infections. So now, every time we say the same thing because this is how we should proceed. And so each time you have pruritus, you should think of all these causes. When we think about allergy, the localization of pruritus can be very useful because when you have food allergy, flea bite allergy, you usually have pruritus on the back. When you have atopic dermatitis, you have pruritus on the extremities, so on the paws and on the face. Remember that food allergy is very similar to atopic dermatitis, with the addition that sometimes you may have pruritus on the back. And so when you have pruritus on the back, you think of flea bite allergy, but don't forget that you also can have it with food allergy. And this is the typical dog that has allergy, that needs drugs to decrease its lesions, to decrease its pruritus. Look at the lesions. He's chewing at the paws. He is rubbing and licking at the abdomen. A lot of inflammation on the head. Many times they also have a lot of inflammation in the ears. So that is the very typical allergic dog, a lot of inflammation between the toes. So when you have a dog like that, we should know why does he have pruritus. And so the first thing in the diagnostic approach to pruritus is to eliminate the ectoparasites. And now we have the possibility of eliminating it. And Zoetis has Simparica. I'm not sure that you have Simparica here. You do? Okay. So why did the NextGuard person say that it was the only monthly tablet to kill the parasites? Ah, okay. So then it is not the only monthly tablet because you have Simparica, right? Okay. So you can use Simparica, it is an isoxazoline. You can use Revolution. In cats, we don't have Simparica. We can use Revolution, and it will kill everything. So that is easy in dogs and easy in cats. Now, after we have eliminated the parasites, we want to check the skin infections. I have mentioned the cats, but I'm sure that Elisa has mentioned that dogs have many more skin infections than cats. I can say that the vast majority of dogs with a pyoderma and the vast majority of dogs with a malassezia have an underlying allergy. This is the #1 reason why animals have pyoderma or malassezia. So malassezia and bacteria, they live normally on the surface of the dogs. So if they are in numbers so much that they cause an infection, they cause an overgrowth, there must be a reason. And this reason many times is an underlying allergy that changes the surface of the skin, that changes the immune system so that these microbes can develop too much. And these infections, you see here the malassezia and here the bacteria, these infections, they will cause more lesions and more pruritus. And so it is a vicious circle because the dogs scratch and cause more lesions and more infections and more pruritus and so on. So we will have also bad smell. You know that dogs with malassezia, they smell like French cheese. You don't eat a lot of cheese, right? Not very much. When you are in France? No, in Holiday. In Holiday Inn. I did not see the cheese. I saw tofu. Indian cottage cheese, okay. That looks like the English people brought it here, right? Okay, you have cottages in India? So, this is the typical dog with a pyoderma, and you see that there are these moth-eaten coats. So we have multifocal alopecia because it is a folliculitis, the hair is lost. We have collarettes, we have pustules. It's a very superficial. Here we have the collarettes, We have some yellowish crusts because it is dry pus. And this is the typical malassezia. You can smell this dog. When it gets in, you can smell it. And when it goes out, you have to open the windows, right? But here you have erythema, well-demarcated erythema, but I don't know if everybody knows this. So some of these dogs, at the basis of the nail beds, have a little bit of brownish material. And here also there is malassezia. And this causes quite a lot of pruritus. Malassezia is an allergen. It will cause a lot of pruritus. So that it will lick and become, again, a vicious circle. So you should check for these complicating infections with cytology, impression smear, sticky tape. You have done that yesterday, and you will find the bacteria and the malassezia, and you should treat it as much as possible with topical therapy. As much as possible with topical therapy. Okay, now we have eliminated the ectoparasites, we have eliminated the skin infection. We want to do a diet trial, and again, the same as Aliza said, and I said, you have to do this hydrolyzed diet trial. We prefer hydrolyzed protein and starch, but if you have a good, reliable, limited antigen, or a good, reliable home-cooked diet, that would be okay, the same. And we know why it should be hydrolyzed. Now, this diet period is really very, very important because it will determine what the dog is going to eat for the rest of its life. It will determine what the dog is going to eat for the rest of its life. So it has to be done really well. And it is difficult for a dog to eat for 8 weeks the same thing and having pruritus. So the owner will not be happy if you don't stop the pruritus together with the diet. And I think that the most effective drug to be used during the diet is certainly Apoquel. And this is because when you give Apoquel, it will stop itching within a few hours. The first time I gave Apoquel, this was a sample, the very first Apoquel we got 10 years ago, because it's already 10 years that we have Apoquel. Can you believe it, 10 years? So we should have a cake here for the 10 years of Apoquel. Yesterday? And I missed it? Okay, too bad. So I missed the cake for the 10 years of Apoquel. When I got the first Apoquel tablet, well, it was the first dog. I gave it to this owner, and I told them, tell me how it goes. Let me know what happens. This owner called me after 3 hours and said, the dog stopped itching. I said, no, that cannot be possible after 3 hours. Yes, after 3 hours. So it is very, very quick to act, but it is also very quick to stop acting when you withdraw it. And this is very important because when I give it during a diet, at one point I want to stop the medication and see if the diet alone is able to keep the pruritus under control. And if you use a drug that has a long latency, you never know when it will stop acting. If you use Apoquel, you stop it, the next day, in 2 days' time, the dog will have pruritus again and will scratch again. And that is a problem because many owners, they take Apoquel and they come to me and say, Apoquel is not working. And they said, but it's not working because when you give it, Apoquel is not working, or because when you stop it, the pruritus is coming back. And he said, no, the pruritus is coming back when I stopped it, so it did not cure the allergy. But that is not the purpose, to cure the allergy. The purpose is to stop the pruritus when you give it. And you have to warn the owners, because many owners take Apoquel and they think, this will cure my allergy. No, this will stop the pruritus. So as long as you give it, the allergy is under control. When you stop it, the pruritus is coming back. And that is an effect that we use when we use the diet. So that is very, very good in this case. Okay, and then we know that if the dog has good results with the diet, we have to do the provocation. We should know if the dog has a food allergy or not. But if the dog is still itchy, and the diet was done well, then we have a diagnosis of atopic dermatitis. And that is a lifelong disease. And it needs a lifelong therapy. Now, lifelong therapy means it needs to be easy to give, it needs to work well, it needs to be safe. I cannot give lifelong corticosteroids at high dosages because it will not be safe. Now, you have such a dog, and you have to treat such a dog, and this dog has a really bad quality of life, like we have seen in cats, and we really need to treat the itch because we know, we have seen it in the previous lecture, that the quality of life correlates with the pruritus. So if we improve the pruritus, the quality of life will improve. So these are the many ways that we can treat atopic dermatitis. You can work on the allergens, for example, hypersensitization. You can work on the infections. You can work on the ears. You can work on the parasites. But most importantly, you should, first of all, work on the pruritus. And for this, you have drugs. You have nutraceuticals. We have also heard some of the presentations, for example, to give a skin diet, like the one we have seen yesterday by Roya Canet. There are many others. It's a good idea. You can work with shampoos and sprays and these things. But if the pruritus is important, and particularly in the first weeks, where you want to get the whole disease under control, you really need to give drugs, systemic drugs. So this is the concept of getting the disease under control with the reactive therapy, and you give this for a short period, but you give a very strong drug. And for this purpose, I think that the only two drugs that are really good because they are very rapid and very effective are corticosteroids and Apoquel. Of course, we can give corticosteroids. Remember that it is much better that we give it only for a couple of weeks because afterwards we get side effects. So if we want to give it for a longer period of time, again, maximum 0.5 milligram per kilogram every 48 hours. But in dogs, it is even more toxic than in cats. And so it would be better to find alternatives. And remember that we should not use deposit preparation. Depot injections in dogs are very bad. You should never use that. So this is what can happen if we use too much corticosteroids, yes. We have Cushing's, exactly like a Cushing. You see a big belly, you have alopecia, you have polyuria, polydipsia. How many of your owners say, I stopped the corticosteroids because he was urinating at home? That was not, that was not doable. A very big problem. They have very thin skin, they are prone to infections. You see here is a pustule. They can get carcinosis cutis. I see quite a lot of carcinosis cutis that come from internal medicine because they give every day low amounts of corticosteroids, but every day, for example, for IBD or for some orthopedic problems, and we get carcinosis cutis. We get infections. Here we have pyoderma because the corticosteroids, they will decrease the immune system. So we do have problems with corticosteroids if you use them for a long period of time. I think that the first 2 weeks is okay to get the disease under control. Then you have to find a maintenance strategy, what we call proactive therapy, to avoid the relapse of the disease. And here, oclacitinib can also be used. So we can use it for the reactive therapy to get the disease under control. We can also use it for the long-term therapy. It is very effective. The dosage is 0.4 to 0.6 milligram per kilogram twice daily. We usually give it twice daily the first 2 weeks, and then you go to once daily. And as I said, within 3 hours, that owner called me after 3 hours and told me, oh, it stopped itching already, and the pruritus will come back soon when you stop it. And you have to tell the owner, this is not a cure for the disease. This is just a symptomatic relief of the itching, which is very important, but it's not the cure. Now, how does it work? Well, there are receptors on the inflammatory cells that are called Janus kinases. And when these receptors meet the cytokine, they will cause a metabolic activation of the cell. And the cell gets activated. If it is an inflammatory cell, the inflammation gets activated. If we stop the binding of all these cytokines, you see them here, with exception of EL5, we stop the binding of these cytokines on the receptors, these cytokines will not activate the inflammatory cells anymore. And so we will not have the inflammation anymore. It is a very elegant way to block inflammation. It is not going to block the whole immune system like corticosteroids do. They will act on the whole immune system. It just will block a small part of the immune system, exactly those cells that are responsible for the allergic reaction. Is it effective? Yes. These are the first studies that were published 10 years ago. And here we have the placebo. This is this light line, and the apoquel. These are the lesions. You see that with time, the lesions of the placebo group do not change, while the lesions of apoquel group, they decrease very much. And the same is true for pruritus. The placebo pruritus does not change, while the apoquel, the dogs treated with apoquel, the pruritus goes down very well. Does this improvement last for a long period of time? The answer is yes, it will not change with time. So this is the lesions, and you see that the lesions improve very well after 2 weeks of therapy, but then when we continue the therapy, the lesions will remain in remission. So there is no problem with giving it for a long period of time. And this is the pruritus. You see that the pruritus goes down nicely for the first 2 weeks. I don't see if you... Maybe we need a battery. It goes down nicely for the first 2 weeks. And then when we look at here, you see that the pruritus goes up a little bit. Why is that? This is when we go from twice daily to once daily. Sometimes the pruritus will increase a bit, but that's obvious because apoquel works for about 12 to 16 hours. So when I give it once daily, I ask the owner, is your dog scratching more during the day or during the night? So if the dog is scratching during the day, I give it in the morning. If it is scratching during the night, I give it in the evening. Some owners may not be happy. This is not working anymore. Do you have batteries? Thank you. So, some owners, when they see that the pruritus is going down nicely, and then it is going up again when you go from once daily to twice daily, they will not will be very happy. So, you may want to continue to give it twice daily. That would not be a problem. And even if it is off-label, we will see that there has been a study of an Italian group. They have monitored dogs for many, many months or years with subsequent blood testing when they were given the drug twice daily, and they have seen that there was no particular toxicity about giving it always twice daily. Of course, the cost is going to be the double. In mild cases, I give it once daily. I don't even let the owner know how nice it is to give it twice daily. So I just start with once daily so that they don't know. And sometimes, if you give a little bit of corticosteroids in the beginning, you will see that this effect is not happening, and that has also been studied. What about side effects? Well, this is the first study that has been published. These are different side effects with apoquel, with the placebo, and with corticosteroids. Of course, we have a lot of side effects with corticosteroids, and if you think about it, if we should register corticosteroids today, they will never pass the registration because they are associated to too many side effects. Imagine a life without corticosteroids. That would be unthinkable. But they have so many side effects that they would not pass the registration process today. And here you see the side effects of oclacitinib, and compared to the placebo, they are not very different. There is no statistical difference. So it is pretty safe. And as I said, there is already 10 years of oclacitinib. And here we have this is one of the first articles, long-term compassionate use of oclacitinib. We have immunomodulatory long-term effects of oclacitinib. We have what I mentioned before, prolonged twice-daily administration of oclacitinib. And in none of these articles, any concern, real concern, has come out when you use oclacitinib for a long period of time. So that should not be a problem. However, what I do, like any drug that you give for the whole life of the animal, you want to monitor. So I advise to do blood and urine testing every 6 to 12 months, which I would do for any drug. Not because I think that oclacitinib is toxic, but because if my animal, by chance, for other reasons, because he's old, develops kidney disease or develops liver disease, he will not be able to metabolize and eliminate apoquel well. And so that can lead to toxicity because the concentration of apoquel will be higher than in a healthy animal. And that's pretty much it. Contraindications. We should not give it in animals that are younger than 12 months of age, which makes it a little bit critical, problematic, when we have a young animal and we suspect a food allergy. Because food allergy very often in dogs is observed before 1 year of age. We start the diet and then we have to give something against pruritus. So in this case, you may give in the future cytopoint, not now, or you may give apoquel, but you should be very careful. The problem of giving apoquel in animals that are less than 1 year of age is the development of demodicosis. So what you can do is you can give Simparica together with the apoquel, just one antiparasitic drug by chance, Simparica, and that's so that you monitor the development of demodicosis. Of course, like any other immunosuppressive drugs, you should avoid to give it in dogs that have a malignant tumor or that have immune suppression. There may be the hypothetical risk of exacerbation of neoplasia. Now, I see a mistake, which I will correct right away. Okay. There has been the report of the increase of development of histiocytoma. Histiocytoma is a benign tumor that is self-limiting, so it will go away on its own. And even if you continue the administration of apoquel, the histiocytomas will go away on their own. So they may be more numerous, more frequent, but it's not a problem. They will go away on their own. And there has been some suspicious of the development of lymphomas with apoquel therapy. However, there have been studies, epidemiological studies, that have checked this, and there is no statistical evidence that apoquel will increase the development of lymphoma. What happens to me more than once is that I got an animal with pruritus that was taking apoquel where I diagnosed lymphoma. Now, I think that the pruritus was due to the lymphoma, and then the dog was given apoquel. It was not that he developed lymphoma because he was taking apoquel. Okay, so you have to be careful about this because lymphoma can be, epitheliotropic lymphoma can be very pruritic. And again, as I said before, we have no idea regarding dogs that have liver or kidney disease. How is the metabolism? We don't know. And so we should not use it in this category of dogs. Okay, there is no influence on allergy test. So for those of you that want to do an allergy test, there is absolutely no difference between dogs that are taking Apoquel or are not taking Apoquel. And the same is true when you do skin tests. Some of you are doing allergy skin testing? Yes? So, yes? My experience is that the wheels will be white and not red. So a little bit more difficult to read, but they will appear. But for those of you that are doing serum tests, there is no difference in the total IgE and the allergen-specific IgE between placebo and Apoquel. Okay. So we have used these very potent drugs to get the disease under control. Now we want to maintain the disease under control for a long period of time, for the whole life of the animal. And that should be done in a very easy, efficacious, and safe way, because this is a drug that I'm going to give for the whole life of the animal. And so we have talked about oclacitinib, but I want to talk a little bit about cytopoint, because this is going to come, and this is called lokivetmab. AB means it is an antibody. The M means it is a monoclonal antibody. Vet means it is a veterinary monoclonal antibody. And I don't know what Loki means. That is so fantasy, right? Fantasy name. So cytopoint is an anti-interleukin 31 canine monoclonal antibody. Interleukin 31 is the most important mediator of pruritus. It is very important in atopic dogs, and you see the level of interleukin in the blood of atopic dogs is much higher than the level of interleukin of blood 31 in blood of normal dogs. So it is very much present in allergic dogs. And the serum level of interleukin 31 also correlates the disease. So the worse is the pruritus, the more you have interleukin 31. So if you can block it, of course, that would be fantastic. So a monoclonal antibody is an antibody where every molecule is identical. It is produced by just one clone of plasma cells. So they are all identical, and they are all specific for one molecule. And they are very, very efficacious in blocking that one molecule. So the affinity and the neutralizing power is very high. And in this case, the molecule is canine interleukin 31. What did I do? Okay. They are identical, but they are also caninized. And that means that by 93%, so everything that is blue here, the molecule is a dog molecule. So if you inject it in the dog will not recognize it. If you inject it in the cat, like Elisa said, the cat will recognize it. And that's a pity. Why don't we have a cytopoint for cats? Because we would really need, you give an injection every 2 months and it's done. Would that not be fantastic for cats? Okay, we don't have it. So if you inject it in cats, cats will recognize it, will produce antibodies against cytopoint, and will neutralize. And the only part that is not canine is the actual part that will recognize interleukin 31. So how does it work? You remember I told you that Apoquel was able to block the receptor that binds the cytokine. So this is the cell membrane. This is the cytoplasm of the cell. On the cell membrane, we have receptors, and when they bind the cytokine, a metabolic pathway will start in the cell and will activate the cell with the production of pro-inflammatory molecules. Apoquel blocks this receptor so that when the cytokine binds the receptor, all this activation downstream in the cytoplasm is not happening. Now cytopoint works similar but different. It will block the cytokine before it gets to the receptor. And in this way, of course, the cytokine will not activate the receptor. And it is important to block interleukin-31 because it is actually the cytokine that will start the pruritus sensation in the nerves, in the brain, that will start the allergic cascade. Is it working? Well, this is the first study that was done in 2017. So in 4 years' time, I come back and you make a cake for the 10 years of cytopoint. This is the pruritus. This red one is cyclosporin, and the green one is cytopoint. And you see the decrease of the pruritus is very similar, but cytopoint is much quicker. This is 28 days, this is 14 days. You see that cyclosporin is very slow, and cytopoint is much quicker. And this is the lesions, and you see that the lesions are very similar improvement of the lesions with cytopoint. So I said cytopoint can be used as a proactive therapy. So once you have improved the whole inflammation, for example with Apoquel, we want to maintain this improvement by giving every month one injection, because this is a monthly subcutaneous injection. And this is the use of cytopoint as a proactive therapy. These are the placebo dots. Every time that the line is vertical, we have a relapse. And here you see that placebo dogs, they all relapse within 1 month of therapy. And this, the green line, is cytopoint, and you see that the line is much more horizontal. It means that the dogs that take cytopoint are relapsing much less than the dogs that take the placebo. So it is able to decrease the relapse. The average time to relapse is 2 months. In any case, we give it every month. So we do not give the disease the possibility of relapsing because we give it once a month. Is it safe? Yes, it is very, very safe. There is practically no contraindication to cytopoint. So you can use it in puppies, in pregnant animals, in breeding animals, in animals that have kidney or liver disease. There are no side effects, only pain in the injection site, sometimes a little bit of lethargy, but there has been no severe side effect that has been described until now. It is very targeted. It only eliminates interleukin-31. So if you have an animal that has a lot of inflammation and a lot of infections, that should not be your first choice. You should take away the infections. You want to give something that is more anti-inflammatory, like oclacitinib or like steroids. You want to use cytopoint for animals that mostly have pruritus without a lot of inflammatory lesions. And another nice thing is, besides that you can give it in dogs that have kidney and liver disease, you can give it in dogs that have diabetes, where you could not give corticosteroids. You can give it in dogs that have leishmaniasis. Do you have leishmaniasis? Yes. So any disease where you do not want immune suppression by steroids or by Apoquel, because Apoquel works also a bit immune suppressive, this is the drug to use. So I have one dog that has pruritus and leishmaniasis, and we use cytopoint because it is not immune suppressive at all. Dogs that have infections, dogs that have hemodicosis, you don't want to use Apoquel, you don't want to use corticosteroids, you may want to use cytopoint. Animals that are less than 1 year of age, where you cannot use Apoquel, you can use cytopoint. So here I have tried to summarize, when do I use Apoquel, when do I use cytopoint? Well, Apoquel, certainly I can use it for the reactive therapy, so when I was to get the disease under control quickly, but also for the maintenance, particularly if there is a lot of inflammation. If I want a short-term use, we have said during the hyperallergenic diet trial, that's ideal, because it is like a switch, you know, one of the switch of the light, switch on, switch off the pruritus. for flea allergy, for example, because you start the flea control, but the symptoms, they will remain for a couple of weeks. And so you have to help them. Or, for example, when you have sarcoptic mange, you start the Simparica, but you want to stop the itching immediately, and then you give Apoquel. That is very effective also for these diseases. Of course, it is not that you see a dog that has pruritus, you give Apoquel, and you don't try to understand why does this dog have pruritus. Because I have seen a couple of dogs that came to me full of Apoquel, and then they had sarcoptic mange, because nobody cared to check if there was a parasitic disease. So you always have to check that. And we are using Apoquel more and more, and we're going to talk about it tomorrow, for autoimmune diseases. It works very well for nasal lupus. It works very well for vasculitis. It works very well for vesicular lupus of the collie. There are several diseases where we now use Apoquel quite a lot. And it's an off-label use. When do you use Cytopoint? For the proactive therapy. So if you have to treat an animal against pruritus for the whole life, it is much easier to make an injection once a month rather than to give a pill once a day, of course. Seasonal atopic dermatitis. So dogs that have a seasonal pruritus, you give 1 or 2 injections, that's done, you forget about it. Dogs in immunotherapy, why is that? Because I do not want to mess around with the immune system when I do allergen-specific immunotherapy. So I use Apoquel, of course, but I would rather prefer maybe to use Cytopoint, because Apoquel, in any case, it is a little bit influencing the immune system, and I don't want that, because I want my immunotherapy to interact with the immune system. So I'd rather prefer Cytopoint. We have seen dogs that have other diseases for which Apoquel is not indicated, metabolic diseases, leishmania, demodicosis, neoplasia. I have now one dog that has epitheliotropic lymphoma, and he has a lot of pruritus. And pruritus in epitheliotropic lymphoma is caused by interleukin 31. That has been discovered in men, and is the same in dogs. And this dog, together with the therapy for epitheliotropic lymphoma, is taking 1 injection of Cytopoint every month. And that is working very well. I would not be able to give Apoquel because that's a malignant neoplasia. Dogs that are yet less than 1 year old, when Apoquel once a day is not enough, so when you want to have a more sustained therapy, and dogs that take a lot of medications, because you know that each time that you add 1 medication, your compliance will decrease. So dogs that have just 1 medication, the compliance of the owners is 80%. If they have 2 medications, the compliance of the owners goes to 40%. So if you want to help the owner, maybe you don't give 1 more tablet, but you can give 1 injection every month, and that will increase the compliance of the other medications that he has to take. So this is everything I had to tell you today, and I am open to questions, particularly if you have questions about Cytopoint. We already have some experience with this. No? No questions? Thank you. Now, the Zoetis people, they have promised that they will give you this, so they will go around and give you 1 copy of this publication on the guidelines for the diagnosis and management of pruritus in dogs. And that seems to be a very nice publication. Thank you very much.
Hello. I request Mr. Prabhu from Drones to give his sponsored presentation. Thank you.
Yes, so there is one question: for how long can we use Apoquel? Can we use it also the whole life? Yes, you can use it also the whole life if necessary, as long as maybe every 6 to 12 months you just check the blood parameters if everything is okay with the dog. But yes, we have dogs that have been taking Apoquel for years now. There have been millions of Apoquel doses that have been given. And I was I was at the American Dermatology Congress last week, and they have analyzed the pharmacovigilance, yes, of the United States regarding Apoquel, and they have seen that the side effects like vomit or diarrhea are mild and are very rare, 2 or 3 out of 10,000 doses that are given. So it's a pretty safe drug. Yes. Okay, as I have said before, the question is the development of cutaneous neoplasia. There has been a study that has observed that there is a significant increase. That does not mean that it is a high increase, but it is significantly higher than the dogs that do not take Apoquel of histiocytoma, which is benign tumor, and histiocytoma will disappear on its own. So you don't have to do anything. Histiocytoma comes and goes away. That is a little bit more frequent with Apoquel, but there is no scientific evidence that there is an increase of other tumors. There has been a study, epidemiological study, a case control study that has checked the animals that took Apoquel and animals that did not take Apoquel, same age, same dimension of dogs, and there is no significant increase in the development of malignant tumors. Okay? Yes, yes. The histiocytoma was a communication at the Congress. I don't know if they published it, but the other regarding the development of tumors, I think it has been published.
Guys, one important announcement, repeating again, breakfast closes at 9:30 tomorrow. Breakfast closes, not starts. Closes.
Doctors, to the Second Indian Congress for Veterinary Dermatology. So I am Prabhu, taking care for Drool's veterinary segment for Tamil Nadu and Kerala. So our overall group view, doctor. So more than 12,000 crore turnover company, 800 plus field force for marketing as well as 50 distribution point. So we are more 35 years experience in animal nutrition. So we have dairy field, aqua field, shrimp feed, and specialized for poultry field and pet food. Over 350 plus product lineup. So we are the India's fastest growing pet food company. So our market share is 45% in just 10 years. Our global presence. So our global presence business coverage is Indian subcontinent, Middle East, Africa, and Australia. So total 18 countries we are in the presence of pet food business. Absolute, highly palatable supplements. So the Absolute, we have syrup as well as semi-moist kibbles form. It's easy to administrate and is useful for furry eaters. We have semi-moist kibbles, calcium, vitamins, skin and coat, digestion, mobility as well as immunity. For syrup, we have salmon oil, vitamins, skin and coat, and calcium supplement. We have VetPro ranges. So VetPro, we have wellness products as well as prescription products. In wellness products, we have VetPro starter, puppy, adult, and we have kitten for separately, VetPro kitten and VetPro adult. And prescription diet. We have obesity, renal, skin and coat, gastrointestinal, hypoallergenic, mobility, cat urinary tract infections, and vet ranges, recovery diet, gastrointestinal diet, and renal diet. VetPro recovery diet. So recovery from any kind of surgery, gastrointestinal, enterotomy, and illness, disease, infection from infection and end of any situations. It's easy to administer, reduce the stress, easy acceptance, and quick recovery. Wet flow gastro gravy. So gastric nourishment, acid reflux prevention can be used for during stomach ulcer, modified intestinal transit time, and nutritional support during rectal bleeding. So we have renal gravy, polydipsia, loss of appetite, vomiting, polyuria, weight loss, halitosis, dull coat, and lethargic cases. So we can use renal gravies. So restricted phosphorus, neutralized free radicals, added potassium, low sodium, and added complex of vitamins. Thank you, doctors.
I invite pet care team to come over to the stage.
My name is Dr. Binu and I represent Pet Care here. So before I start my presentation, there's something I would like to say. It's an honor to be standing in front of such renowned veterinarians, my seniors, my juniors, and being an alumni of Madras Veterinary College, my professors, my gurus. It's a real honor, sir. Thank you for this opportunity. So, moving on to the product portfolio. You know that pet care is part of the Cargill family, and Cargill has presence all over the world. In India, if you see, they are present in more than 100 locations with 12 manufacturing units in India alone. Cargill Animal Nutrition and Health has presence in all the segments, including dairy, poultry, aqua, and pet. And I am representing the pet care division. So pet care division, you know, since 1989 we are in the market, and it's only the trust of the doctors that has taken us so far. Thank you from pet care team. Moving towards our portfolio, we are strong in supplements, the derma care range, the parasiticidal range, and therapeutics range. I know that most of you are familiar with all of our products, but I would just like to go through it. Please bear with me for 2 seconds. Notex shampoo and powder, Notex powder for prevention, and Notex shampoo for treatment of ectoparasiticidals. Amitraz, we are the pioneers in Amitraz in India, presenting RIG for mange treatment. Medipet, fipronil, again an ectoparasiticidal, which is pregnancy safe as well. Moving towards the endoparasiticidals, we have Worm Trap for adults, Worm Trap P for puppies, Prazic Plus, again albendazole and praziquantel tablets. Our derma care specialty range, we have Pet Ben, which is a unique follicular flushing shampoo, effective in all types of skin infection. When combined with Rid and Nutricoat, it's excellent treatment for dermaticosis. Petex for mixed infection of the skin, both for bacterial as well as fungal infections. Celidrif, it's again a shampoo which is recommended for seborrheic dermatitis. Along with skin infection, we would say that in our portfolio we have Nutricoat Advanced, which is a concentrated omega-6 and omega-3 supplement recommended for cases of dermatitis for skin rejuvenation again. In our derma care regular bathing shampoos, we have Heifer. This is an excellent premium shampoo containing rosemary oil, aloe vera, and Vijayam oil. Not only the hair, but also the skin is important when it comes to growing hairs. Rosemary for the growth of hair, and Vijayam oil and aloe vera for moisturizing of the skin. Definitely a premium shampoo for premium pets. Notex Green shampoo, Notex Green soap for regular bathing. Combined with Nutricoat which is a mixture of not only omega acids but also vitamins, an excellent supplement for skin. In the Dermacare therapeutic range, again, PetCare has Peaches, which is hydrocortisone acetate, for all types of atopic dermatitis allergy cases. Selamac, you know, it is selamectin, an endectocide for both external and internal parasites. Combined with PetClean for dermatitis cases, Peaches has given excellent result in atopic dermatitis, and there are many trial reports we have for these. In the supplement range, we have Provi-Boost drops and syrup. We have Livoferol Pet. We have Provi-Cal Pet, the calcium supplement. I'll not go into details of all this as I have something else for you. The supplement specialty range, we have Pet Joint and Pet Joint Plus. Now, Pet Joint Plus is definitely a plus because we have added MSM and hyaluronic acid into it for better pain management, for better recovery from chronic joint issues. And this is our new introduction, NutriPet. This is to help pets live healthier lives. We have introduced NutriPet powered by Epicor Pet. This product not only optimizes gut health but also supports immunity. And what is Epicor Pet? Well, it's a #1 postbiotic brand, which is a whole food ferment, clinically shown to support immune and gut health. It's made through a specialized fermentation process, which actually creates a unique fingerprint of metabolites. Includes proteins, peptides, antioxidants, polyphenols, nucleotides, and all these metabolites can be directly provided to the pet, increasing their gut immunity and immune support. So when taken daily, this Epicor postbiotic acts like a multivitamin, not only for the body but also for the immune system. So that is what it targets, the immune system. Now how does it do that? So it makes the immune system more efficient, there is less systemic, so that there is less need for systemic immune response. Again, it provides better immunosurveillance, which it increases the cells which will watch for threats and signal quickly so that the body is able to recover quickly from any possible threat that it faces. It enhances the capacity of the immune cells to react towards any foreign body or any foreign threat. It boosts the immune system's ability to react to these threats when challenged. It supports the good bacteria and helps reduce the bad bacteria in the gut. And how does it do that? Because it reduces fusobacterium and increases bifidobacterium in dogs. Now these are all studies that has been done throughout 75 years from Kargil. So it maximizes the nutrition absorption by intestine villi, making it more dense and absorptive. So in cases of chronic diarrhea and cases of parvo, we have got excellent results with this. Also in cases of IBD, we have seen that the dog has responded very well to NutriPet. Vitality, yes, it has shown to increase vitality by 15% and lower indications of oxidative stress. So yes, overall, this is an excellent patented fermentation technology we have used to get Epicor. Stable and reliable, it is completely science-based, and I would request all the doctors here to support us for this product. For any further information, sir, you can always contact our team. Thank you. Thank you so much. So thank you, the organizers, for giving us this opportunity, and I request you all to support us as you have been doing for so many years. Thank you.
Hello, welcome to the last presentation of the day. Today we are talking about nasal disease. The nosepad of our animal has neither follicle nor glands. So we only have a very thick layer of epidermis within underlying dermis. The hydratation of the epidermis depends on leaking on the nasal gland and a little also on the tearing of the eyes through the nasolacrimal duct. The epidermis is much thicker. On the left, you can find skin of another area, for example, abdomen, which is thinner, and we have a next and gland of hair here. On the right, this is the nose, where the epidermis is much thicker, as you can see here, and there are also digitation that are called red ridge. And the stratum corneal is thick and compact, as you can see here. This digitation form a regular surface on the nasal planum and are polygonal, as you can see here, and they resemble a Kabbal's rod. They are important because within these small cavities, water, humidity, saliva, they just go inside, and they are important because they keep the nose moist and well hydrated. The pigmentation depends on the breed. We can have noses that are black, like in this dog. We can have dogs that have a brown nose, and this is also called a liver nose or chocolate nose or even a red nose in some breed. We can also have a white nose. For example, this dog is an albino dog, and as you can see, it lacks completely the pigment, and that's why we see the nose is not really white, it's pink, because he has no pigmentation at all. Pigmentation may vary also with age, and it can present more or less pigmentation with age. Normally we have puppies that they are adopted with just few patches on the nose, and then after 4 or 5 years they have completely pigmented nose. In some animals, especially in cats, we can have also patches on the nose. For example, in cat we have a lentigo simplex, and we can see this especially in red cats. This is normal. We can also have on the lips and also on the conjunctiva. It's very important to know that these are normal, because sometimes the oral they can come, they are worried because they think it's a tumor. Then we can have also a typical form of nasal planum, always in the normal range. There is a breed which is called Spanish double-nosed dog, that he has this very deep fissure between the two narines, and you can think that the two nostrils are detached, but this is just because the space between them is just too deep, but this is normal. Now we can see which are the lesions that are pathological. For example, we can have the pigmentation, erosion, ulceration, crust, hyperkeratosis, and nodules. Let's start with the depigmentation. The pigmentation can be inflammatory or not inflammatory. So the non-inflammatory depigmentation does not have the alteration of the anatomical structure. We can see here a nose with a little pigment, but which has the normal structure. You can still recognize the little cobblestone surface. On the contrary, here on the right, you can see that there is an inflammatory depigmentation. You can see that you don't recognize anymore this structure of the nose. And this is because this nose is edematous, smooth and shiny. And if you see very well here, there are not several, but there are few ulcers. Erosive and ulcerative lesion can cause the production of crust. And the color of crust is very important because it depends on the exudate that has been dried. So in this case, they are black because they are originated by ulceration. When the the disease is pretty deep, it involves the dermis and so also the blood vessel, then can cause bleeding, and we have discussed that when this exudation, this bleeding, and when it dry, we have this black crust. We can also have crusts that are yellow, and this is because the original lesion where there was a pus, and when this purulent material gets dry, we can have this yellow crust. This is typical of infection, bacterial infection, but we can also see in pemphigus foliaceus. Hyperkeratosis is the excessive of keratin production, and this is, we can see often on the dorsum of the nose. And this is depending of or keratinization problem or deficient hydration of the nasal tunnel. We can have also nodules. They are not so frequent, but we can have, for example, here there is a little nodule. Concerning the depigmentation of the nose, we can have a physiologic depigmentation. This is the snow nose. And it is physiological because the dog is fine, is a depigmentation that can appear through life and can appear and disappear. It can improve or worse with the season or with age. And this is manifest mainly in the central part of the nose. We can see this condition on the Nordic breed and also in hunting dogs. This is similar to the snow nose, and in this case, the Dudley nose is another condition where we have a pigmentation. However, it occurs all over the nose pad. In the snow nose, there was just in central part. Here is all the nose that is affected. It also can worsen and improve, and as you can see, the surface, it looks pale. Well, we can differentiate with the snow nose just because in this case it affects the entire nose pad. A pathological but not inflammatory condition is the vitiligo. The vitiligo is a non-inflammatory depigmentation, and the surface of the nose is still normal. As you can see in this picture, you can still recognize these irregular cobblestones. And also, there are no erosion, nor crust, nor also ulceration. But there is just this loss of pigment that is not diffuse. It is indeed well demarcated. You can see these patches like if it was a geographic map. Here are other pictures showing that the superficial, the surface of the nose, the structure is conserved. And in the right picture, this is a cat. Also, cat can have vitiligo, and we can see this especially in a Siamese cat. Here is a case that I've seen recently, is San Bernard. And as you can see also, the depigmentation can involve the nose. As you can see, there are well-marked depigmentation, and it can also involve other areas, for example, the lips and also the chin, and here the lips as well. Other skin area can be affected. We can also have on the mouth, on the mucocutaneous areas, periocular and vulva. Different than the disease with the depigmentation are epitheliotropic lymphoma, here we can see that the structure of the nose is not conserved. You can see that there is a loss of the structure, there are edema of the tissue, and also we can have a crusty lesion and then ulceration. This is the case of the epitheliotropic lymphoma, and it starts normally on the filtrum, and we can also have on the central upper lip, and this is typical for epitheliotropic lymphoma. Of course, with the time, the pigmentation can also spread on the other part of the body. In this animal, we have the pigmentation of the nose, and in the advanced stages, we can also arrive to have a loss of the tissue with also ulcers. In this dog, there is the pigmentation, but with the time, we can just have a worsening of the clinical lesion, and we can have also the formation of plaque and also with nodules. Another very frequent reason for inflammatory depigmentation of the nose are the autoimmune disease. In this case, we can see nasal lupus, where we can have the pigmentation mainly on the upper part of the nose and also on the lateral part of the nose. In lupus, erosion are observed, and they can then, if we don't act quite soon, they can then become ulcers. And if we don't give a treatment with the time, we can have also the loss of the tissue of the nose. In the more advanced stages, as I said here, you can really see loss of structure. Also, we can have a severe depigmentation, as you can see in this picture. You can see blurred margins with the ulcers, and you can see the destruction of the nose. In the other picture, you can see very well how there is the depigmentation, the ulceration, and the crust. Another disease that can cause the pigmentation of the nose is the pemphigus erythematosus, which is also characterized by a crusty lesion on the dorsum of the nose that sometimes they can also cover all the nasal dorsum. We will see in the next slide. These are yellowish because they are caused by dried pus, and they are different from those that I showed before that are dark and hematous, because in that case they were originated from the ulcerative lesions. Here we note how pemphigus erythematosus can involve not only the nasal planum but also the dorsum of the nose, as you can see in this picture. In this case, above all, you can see how this condition can be similar to a lupus, but we now know that this is nothing to do with the lupus. And here in this picture, you can see the yellow crust resulting from dried pustules. Also, in cats, we can have formation of a yellowish crust on the nose. This is a pemphigus foliaceus in a cat, and here the same for the dog. The yellow crust are coming from dried pustules. If here you use a glass slide and you try to remove the crust and then you do the cytology, you will probably see see the acantholytic cells which are typical of pemphigus foliaceus. Pemphigus foliaceus is not just limited to the nose. We can have also crust and pustule inside the auricular pinna, like in this cat, and we can have this interesting manifestation, which is the presence of caseous material in the nail bed, and normally it's not just one nail, should be more more nails. And if you do the cytology here, you also find a lot of neutrophils and acantholytic cells. There are other autoimmune diseases that cause lesion of the nose, and now we are going to talk about the vesicular disease of the dermoepithelial junction, and then we will talk about also about bullous pemphigoid, epidermolysis bullosa acquisita. In this disease, the target of inflammation is the basement membrane, and if this is attacked, it is not longer able to keep the epidermis connect, and so we will have a clear detachment of the epidermis. Here we can see, for example, in this nose, we can see this area lack completely the epidermis, and there is this diffuse erosion. But if you see, there is no bleeding here. It's just missing the epidermis. And this is because it doesn't affect the dermis. And the same in this other picture. This epithelialization does not involve only the nose. We can have also detachment of the oral mucosa, like we can appreciate in this picture, and we can also have the detachment of the epidermis from the pores and the underlying adipose tissue. Let us now look to the nasal diseases that are caused by trauma. So we can have ulceration and crust which are secondary to trauma. For example, we can have electrocaution. So when, for example, we have some young and very curious animals that they are going to eating the cable, they can be fulgurated by this, and so we can have the lesions like in this cat. Or, for example, if in dogs that has been scratched by a cat. A lesion in the filter of dogs in this location, if they are of this breed, San Bernardo Schnauzer, is associated to vasculitis. This is very important to be able to recognize, because if the ulceration goes deeper and involves a big vessel, we can have also important hemorrhagia that can be severe for the animal. Also affecting the nose of the dog, we have the idiopathic nasal dermatitis or German Shepherd, which is also called German Shepherd nasal xerosis. It is observed in older dogs and is characterized by bilateral fissuration, like you can see here, of the nose. This nose is very hard, and that's why the nose cracks. Here in this picture, you can see this linear ulcer, we can also call a rugged, and we have the impression, if we look very well, that this nose is pretty hard. Nasal dryness can be caused by lesion in the can be caused or by a problem in the sympathetic system, and this can be caused by the age and probably also by the genetic, because there is male in this breed. Here we have other picture of this disease. Is often bilateral, is symmetrical, and with the time it gets infected. So we have to keep in consideration when we give a treatment. Treatment of this type of a lesion is mainly hydration, so we can use propylenic glycol or also cream with urea or Vaseline. But when there is infection, like in this case, we can see that there is production of pus. We should use also antiseptic or antibacterial treatment. Also in German Shepherd, but not just in this breed, we can have mucocutaneous pyoderma. It's a disease that involves the nose laterally, where there is here the end of the nostril. And it starts with the pigmentation, erosion, and then we can have crust. It responds to antibiotic therapy, and sometimes we can have the recurrence of this disease. So it is not real clear if it's just a different disease, or it may be a very mild form of an immunomediated disease that gets infected all the time. Here is another picture of this condition. It can also affect the perilabial lateral canthus of the eyes. And as I said, the therapy is based on antibiotic. We can have ulceration and crust near the nose, even with viral infection. In particular, herpes virus. Herpes virus is contracted when they are young in a kitten. Actually, they get in the beginning is associated with rhinitis, and then the virus stays latent in the lymphatic ganglia. And when during the life of the cat has a very big stress, or he has experienced immunosuppression for other reason, this virus through the lymphatic ganglion come back to the skin and can cause the lesions. We can have a lesion on the muzzle. We can have around the nose, like in this cat. And they can be appreciated with the ulceration and the plaque-like lesion on this area. But not just in this area. Indeed, we can also have ulceration of the tongue, like all the other respiratory virus in cat. We can have also other skin lesion, ulceration crust, for example, on the ear, like in this cat. But this is a virus that can also cause a severe problem on the eyes. In cat, the most frequent cause of ulceration and crust of the nose is, without any doubt, the squamous cell carcinoma. It is mostly like we saw the first day in white cat, and above all in cats that can go outside, because this is sun-induced. It can start with a very small crust, something very, very small, but the owner reported that this crust seems healing, but then it's come back. So this should be kind of a clue for us to investigating more the nature of this crust. With the time, it slowly progresses to ulceration, and then also with the formation of crust. Here you can see over time this ulcer proliferated. Sometimes they can be really proliferating, but they also have the tendency to destroy the tissue that are around the nose, and so we have also cases that where if we don't treat, it becomes so infiltrative that can invade the underlying tissue and even larger part of the face. In addition to the nose we saw yesterday with my Minkun, that I show that we can have involvement of the lateral canthus of the eyes, or even medial canthus, like in this cat and also the pin. Basically, all parts that are white and maybe less protected by the hair. Other cause of small erosion, cracks and papules is the hypersensitivity to mosquito bites. Here we have a multiple lesion and eroded papules which are sometimes covered by crust, as you can see here. They mostly involve the dorsum of the nose. They can arrive to reach the space between the eyes. This can really bother the cat. Here is another picture, other two pictures where I show that the papules involve the dorsum of the nose, but can also involve the pinna of the cat. This is an easy diagnosis because when we have several little papules, we are not talking about pustules. These are papules, so there is not pus here, and they are small. And if we perform a cytology here, we have many eosinophils, and this can confirm the allergic nature of this disease. Cryptococcosis is not frequent, but it can also affect the nose of cats. Cryptococcus enter in the nasal airways, and here is the place where it starts to multiply, and it gives the first nodules on the nose. They are mainly nodules, they can be also papules, and what's happened is that with the time they just ulcerated and they discharge a purulent serous ooze. With the blood dissemination, then we can also see this cryptococcus that is spread on the body, that produce other nodules or plaque with this viscid exudate that can we see in the rest of the body, like in these animals. Let's now talk about hyperkeratosis. So hyperkeratosis is an excess in the production of stratum corneum, and we can see this easily in some breed, for example in the Cocker Spaniel. The nose of this cocker get very dry, and since it's dry, it can also cracks and then infected. More or less what happened also in the German Shepherd xerosis. Because it's very hard, this crack. Sometimes we can also have a part of this keratin that is detached. We can see this more in an old dog. We also have nasal dryness in animal in which there is a deficiency of the production of tears, or because there is where the nasolacrimal duct is stuck, and this can happen in some breed, for example in brachycephalic breeds. What happens is that the keratin starts accumulating on the dorsum of the nasal planum, as you can see in this picture. In some cases, there is idiopathic hyperkeratosis in older dogs, and this is because there is a reduction in the function of the nasal gland, or decreased production of the tears, and this happens often in old age, and so they have deficient hydration of the nose with the excessive production of the horn. This happens above all on the dorsal part, as you can see here, but also on the lateral part of the nostril. In some cases, the hyperkeratosis has a real genetic cause. For example, here we have the hereditary idiopathic nasal parakeratosis of the Labrador Retriever. This occurs in young animals. We talked before about old. These are young animals. They are between 6 and 12 months of age. In this disease, we can see that the dorsal part of the nasal planum present hyperkeratosis. But what is important that if we see where there is not this hyperkeratosis, we can see that irregular cobblestone structure is lost, and we have erosion and depigmentation. Another genetic and hereditary disease that leads to hyperkeratosis of the nose is the nasodigital hyperkeratosis of dog de Bordeaux. And it is also called nasodigital because we have also an excessive production of the tetracium corneum also in the pupils. And sometimes this is so much that the production of the horn makes difficult for this dog walking. In this case, what we can do is, of course, try to moisturizing the surface with, as we saw before, Vaseline solid, uric cream 10%, propylene glycol. But sometimes when you have horns like that, you need just to trim and to cut away. Let's see now the diseases that are associated with the nodules and plaque. For sure, neoplasia, as I said, they are not so frequent, but we can have. Starting from the left to the right, we have a muscle tumor. We have the beginning of the depigmentation in an epitheliotropic lymphoma, and we have very little melanocytoma. We can have a papillomavirus. This is a dog that presents a very small papillomavirus on the dorsum of the nasal planum. He had others here, so we have 4, and the same dog also had on the gingiva and also huge papillomavirus horn on the paw pad. This dog couldn't walk with this horn on the paw pad. After we have seen the disease of the nose, we can see the lesions that are on the dorsum of the nose. Here we can have alopecia, erythema, pappus ulceration, pastor crust, and nodules as well. So alopecia of the dorsum of the nose is a typical sign of hypothyroidism. So especially if we have a medium to large size dog and a middle age. So if you see this, rule out hypothyroidism. Sometimes we can have this spontaneous in small dogs, for example, Dutch Hound. You can have also in Pinscher and also in a Yorkshire Terrier, but this is absolutely physiological and sometimes associated also with alopecia of the pinna. Alopecia of the dorsum of the nose we can also have with dermatophytosis and demodicosis. This is the same dog. Here it was 12 days after we started the therapy, and here is demodicosis. Erythema and edema. So in a white dog, the dorsum of the nose is really exposed to the sunlight. These dogs, they do not have a lot of hair here that protects from the sun. So we can see the sign of the sunburn, and we can see edema and erythema. So you can understand that there is edema because where there is the white the white coat, you also can feel it. If you touch it, you can feel it that there is a difference between the white and the pigmented areas. Is swollen, so you can feel that there is a difference in the thickness of the skin, and this is because the unprotected skin is edematous and erythematous. In the beginning, you can see the hair loss, you can see this erythema, the swelling, then with the time you can have folliculitis, furunculosis, and sometimes with the time we can have also the formation of squamous cell carcinoma. Also in this area we can have a very violent and fast formation of these ulcerative papules. They are really bothering the dog, and if they look bad, actually they look like tumoral, but if we perform the cytology, we will see that these are full of eosinophils. This is the eosinophilic furunculosis. We think that is associated to the menoptera stings like wasp and bees, and it occurs mainly in those dogs that put the nose everywhere in the bushes, for example. It is very violent, very quickly to appear, but is also quick to disappear if we give cortisone for a few days. The presence of pustles and crust on the dorsum of the nose can be also associated to pemphigus foliaceus. Sometimes they are isolated, sometimes they are just so many that they just get together and we have a full crusting of the dorsum of the nose. And if you perform the cytology, you will see that you have acantholytic cells and a lot of neutrophils. Nodules, we can have nodules here. We can have histiocytoma. This is quite frequent, but we can also have nodules that are not caused by tumor, but just by the proliferation of inflammatory cells. I forgot to put the spray against the fleas, and I have a flea that is just, and AC fleas moustique. So we can have nodules on the dorsum of the nose that are caused by proliferation of cells such as the osteocytic. We have the reactive histiocytosis. Cutaneous histiocytosis has a predilection for the nasal dorsum. And we can see in this dog we have nodules on the dorsum of the nose, but it's not just limited here. We can have also dissemination. As you can see in this dog, we have several nodules. These lesions tend to respond very well to the cyclosporin. Here is another dog. He started with the first nodule on the nose, then he had others around the nasal planum, and he had also on the ears. Let's look now at the diagnostic approach to the nasal problems. If we have exudative material, it's a good idea to take the cytology, so we can have already few clues. For example, if we see that there is an infection, like in this case, where you can see the neutrophils and a lot of bacteria, you need to give antibiotics. You need to give antibiotics for 2-3 weeks, and then you have to check for improvement. In case of mucocutaneous pyoderma, for example, the infection will completely cure after 2 weeks of antibiotic, and the animal will be healed. In case the pyoderma, in case we have an underlying disease which is complicated by a pyoderma, if we give 2 weeks of antibiotic, there will be a partial improvement, not a complete. So in this case, after 2 weeks is the best moment to take the biopsy. Why? Because there will not be the infection, and the work of the pathologist will be much easier. Sometimes when we do cytology by apposition, we can find neutrophils, and instead of bacteria, we can find just the acantholytic cells, like in this case. So here, if we don't see bacteria, you don't need to give 2 weeks of antibiotics. We'll do immediately the biopsy. Why I do biopsy, even if I think that is a clear pemphigus foliaceus? this is a long-term therapy. You have to give probably therapy for the rest of their life. It's good to be sure to have something to prove that you are giving the therapy for the rest of their life. So I recommend to do the biopsy in any case. From the popular lesion of the dorsum, the nose, in both dogs and cats, you can find a lot of eosinophils. If it's a dog, it is probably eosinophilic furunculosis. If it's a cat, it's a hypersensitivity to mosquitoes. Hypersensitivity to eosinophilic furunculosis is not so frequent. As I said, is OARS or bees, so it can happen occasionally. But if it's in cat, hypersensitivity to mosquito bites, this can be recurrent very often. So that's why we suggest to use a repellent collar that should be had all time. So I don't know if you have, for example, Seresto. Do you have the collar Seresto? This is enough repellent and is also okay for cats, so I will use that for this kind of disease. In some cases, from the ulcerated nose, you can do the cytology. You can find directly the yeast of Cryptococcus. How can we recognize these? They have this white halo, which is the capsule. This capsule doesn't take the color. You recognize because it's the only one that does like that, and is surrounding the body of the Cryptococcus. If you have a proliferative lesion, it's better to do the cytology. It's true that do a cytology on the nose of the dog can be tricky, can be difficult. But if we are not able to do the fine needle aspiration, which sometimes if you use the needle, then the dog is moving. If you are really well keeping steady the dogs, you risk to hurt with the needle and to have like a bigger lesion. So I suggest that just to use the needle without the aspiration. You put, the dog is moving, but the needle is still there, and then when it's come, you just roll a bit, and then you put on the syringe, and you have your material on the slide. The majority of nodules allowed you to have enough cells, even though you didn't aspirate. Here, this dog had mastocytoma, and the cytology revealed presence of mastocyte, confirming the suspicion of mastocytoma. And we have seen that the nose can have also infiltration of lymphocytes when they have lymphoma. So if you have a nice lesion like a nodule which is ulcerated, I will go just for a position, or if it's not ulcerated, I will try to do the fine needle aspiration, but this time it has to be very superficial because the lymphocytes are in the epidermis. Remember that in the nose of cat we can have squamous cell carcinoma, and the cytology here is not so easy to be interpreted. Indeed, we can have many inflammatory cells. Since it is ulcerated and normally it's chronic, there is also a lot of infection. So you can just write with a position, and if you are lucky, you can see the tumoral cells in the epidermis, and you recognize them because they are very keratinized, but they still retain the nucleus. So in case where we do not have a quick diagnosis from the clinical and cytological picture, the best approach is give antibiotics 2 weeks. Then, if it's improved, it was mucocutaneous pyoderma. If it didn't improve, there is another explanation, so do the biopsy. How to take this biopsy? Ideally, it would be better to take more than one biopsy. I'm not gentle. I all the time take 3 to 5 biopsy, and I use a punch with the size between 4 and 6 millimeter. Of course, if it's the dog that I will show you in the next slide, I use 6 millimeter. But if it's a small dog, probably will go for 3-4 millimeter. You can do on general anesthesia. Impossible to do without anesthesia. It's so sensitive, this area. And I do general anesthesia, but most of the time I do just sedation, for example, medetomidine and methadone. And then when the dog is calm, I use the lidocaine. So I do a block of the nose so I can work easily. It's an area that bleeds a lot, but you don't have to be scared. It will also stop bleeding as soon as you put a stitch. I use all the time the material that is reabsorbable, so that I don't have to sedate again the dogs to remove it. And what I do is to give for 5 to 7 days an anti-inflammatory drug. Where I do the biopsy, I prefer the part that are depigmented, and also I love to take between the normal pigmented area and the part that is depigmented. This will give to the pathologist a lot of information, and these are perfect when you have a lupus. Otherwise, if you have a suspicion of pemphigus, you have to look for pustules. Pustule, an intact pustule, you have more the information that you need. But if you don't have, as in the majority of cases, you can take the crust. The crusts are very important because they are full of acantholytic cells. If there are erosion, they are okay, you can take it. But honestly, if you have a frankly ulcerated area, don't biopsy them. They are not useful for the diagnosis. They are too old lesions. What's happened? Sometimes if you have a very hyperkeratotic nose, it's difficult then to close. So if I do the biopsy in a very dry nose, I prefer to use a smaller punch, but maybe to do 1 or 2 extra biopsies. So even if the dog is removing the stitches, it will bleed probably a few hours, but then it will heal for second intention. Remember to give the collar, the Elizabeth collar, to the dogs for 1 to 2 weeks. Here is the last picture. Is dogs with vitiligo, and I love to take a picture when I'm going to take the biopsy, because I have a wonderful relation with my pathologist, and I like to send also a picture, a photo where I collect the sample. So for example, as I said, the space I do the biopsy in between the depigmented and the pigmented area, like here, or like here, or also where there are crusts. Thank you very much for your attention. Do you have questions for me? I have no time, sorry.
Yeah, guys, we are not breaking. We are not breaking because we'll finish with the last lecture. That will give you time to freshen up and then come down. So we'll just be going ahead with Dr. K. I hope everybody is okay with it. We are skipping the tea break.
Okay. Now, the last lecture. Are you still alive? Do you want to get up, stretch your legs, and get down again? Okay. So we're going to talk about ears. Now this is called topographic dermatitis. Elisa talked about the nose, and now I'm going to talk about the ears. But because I'm the cat person, I'm going to talk about feline otitis. And when you think about otitis, you think dogs, right? They are not so frequent in cats. So that is why it is so particular that we talk about otitis in cats. And I'm going to talk about otitis externa. So I'm not going to mention otitis media, although you will find information about otitis media in your proceedings. But we cannot do everything in just 50 minutes. And maybe we should have this clock? 45 minutes, that's even worse. But this is the last lecture, so I can just talk a little bit more. Okay, so we just start from the basic anatomy of the ear. This is the basic anatomy in the dog. So this is the pinna, this is the external ear canal, and we know that there is a vertical ear canal and a horizontal ear canal. And at the end of the horizontal ear canal, there is the tympanic membrane. And from here to outwards, this is the external ear. And from the tympanic membrane inside, this is the bulla, this is the middle ear, and this is the inner ear. Now we have cartilages. This is the cartilage of the ear canal. And when you touch it, it should be soft. If you touch it and it's hard, this is bad news. It is calcification of the cartilage. This is a very chronic otitis. Now the cat is different because the cat has, here is the pinna, a quite short and straight canal, so that it is much easier if you go inside the ear of the cat to reach the tympanic membrane. This is the first difference. The second difference is that there is a septum that divides the bulla from the rest of the middle ear, and there is only a small opening, so that it is very difficult when you do videotoscopy to get material from here outside. The third difference is that the organs of the balance and of the hearing are exactly here. So when you get inside, for example, when you want to make a ear washing with a tube and the tympanic membrane is broken, you can come here and damage this area. There are nerves that get here, the facial nerve, the auditory nerve that are all here. So this is a very delicate area. So the point is you should deal with the feline ear in a very delicate way, because the canal is shorter, is straight, and because everything is here you can damage. While with the canine ear canal, if you get inside, you will never be able to get to the tympanic membrane. For example, with a Q-tip, you will not damage the tympanic membrane, but in a cat, you can get here much easier. So you should be careful. This is how the vertical ear canal looks in a cat. This is the annular cartilage, just to show you. This cartilage here, you see that there are different cartilages. Here there is a superimposition of a cartilage. So when there is the nick between the vertical and the horizontal ear canal, there is this cartilage, and you can see it also here, the annular cartilage, and you have to get over it. You can see it here inside the ear, and this is the tympanic membrane, which is essentially the same as in the dog. So you have the attachment of the malleus, the hearing bones, you have the pars tensa, and you have the pars flaccida here. And this is what you see in the tympanic membrane. The middle ear is similar. However, as I said, the opening of the hearing and of the balance organs is just here in front of the tympanic membrane. So if you get inside with some tubes, for example, to wash, you can damage this area. And it is very difficult to get the material outside of the bulla because there is this septum with a very small opening, so that with your tubes it is difficult to get in here. Okay, now the ear, after the anatomy, we look at the diseases. We have a pinna, we have an external ear canal, we have a medium and inner ear. As I said, I'm going to talk about what is the external ear canal and the pinna. I'm not going into the middle ear because there it is usually something that the surgeons do, not so much the dermatologists. And also I would like to talk about the diseases of the pinna because the majority of the problems of the ears in cats are actually diseases of the pinna. We don't have a lot of otitis in cats, with the exception of otodectes, but we have a lot of diseases of the pinna, and I'm going to show you some of these. So this is probably the most frequent, and this is allergy. We have talked about allergy the whole day. You see erythema and papules, and I told you before, particularly on the basis of the pinna between the eyes and the ears, sometimes you really see papules and erythema on the basis of the ear. When you see this, think of allergy. And usually cytology from these lesions is very eosinophilic. We have already seen insect bite hypersensitivity, and the typical lesion is the papules, because these are the insect bites. And these papules, they sometimes ulcerate. You have these erosions, and when you do cytology from those, it is also full of eosinophils. So this is an easy diagnosis. Remember that you can also see the papules on the nose, like Elisa has just shown you with the nasal diseases. Well, we all know dermatophytosis. We know that the ears are an area of predisposition, as well as the muzzle and the front paws. And this is because usually the kittens, they acquire the dermatophytosis from the mother when they are breastfeeding. And so the areas that are in contact with the mother, the face, the ears, the paws, are the ones that get infected. And here you see alopecia. You see this ash-like scaling, which is typical of dermatophytosis, together with the alopecia. You put this under the Woods lamp, it's going to be fluorescent. You make a culture, and you can also make trichoscopy. Did you have dermatophytes in your trichoscopy yesterday? You didn't have. Okay, but once you have a dermatophyte, you can pull the hair, and here you see that the hair structure is just full of hyphae. You don't recognize the medulla and the cortex. You just see a lot of hyphae. This is a very infected hair. Do you have trombicula? Yes. So trombicula is a parasite that is small and orange, and often it will be found in this pocket. You see that the cats have this pocket in the ears. This is, I think, called the pocket of Vögel, if I'm not wrong. Enris, not Vögel, Enris. Vögel is a mechanoceptor, I think. Enris pocket. And in this pocket you can find these many parasites. They are small ticks, but they have 6 legs. And you will tell me, but ticks usually have 8 legs. They have 6 legs because they are larval stages. And the larvae of the ticks have 6 legs. The adults, they are in the environment, they are not parasitic, but the larvae, they are parasitic. And they can be also pruritic. You find them in the ears, but you can also find them between the toes. They are easy to see because of this orange color. You see, here we have the larvae of the tick with 6 legs. Well, notohedric mange, you see it much more than me. This is the mite, very numerous when we do skin scraping, and the typical area to find notohedric mange is on the pinna. Particularly, you see a lot of hyperkeratosis on the border of the pinna. When you see something like that, this hyperkeratosis, you do a skin scraping and you find a lot of notohedris. Here you have a nice electron microscopy image. Well, you have a lot of sun, although here in Kochi I did not see a lot of sun. Every morning I open the window and it's like no sun. Maybe there is a lot of pollution, I don't know. Tomorrow we have sun, okay. But I can imagine that you have a lot of sun in this country, right? And you may have lots of cats. I was just talking with somebody that your cats, they live a lot outside, right? And so you know what I mean. This is solar damage. Solar damage can cause alopecia, can cause the folding, the deformation of the ear tips, can cause erosions. And when you start to see the erosions, this is not good news, because you know that solar damage with time will lead to squamous cell carcinoma. Actinic keratosis, it's solar damage. Yeah. It's the, let's say, this plastic form of the epidermis. It's not yet neoplastic, but it is not normal structure. Is a development of what will become, in fact, a squamous cell carcinoma. So what can you do? If you are in this situation, you should give high-potency steroids for at least a couple of weeks. Like methylprednisolone or prednisolone at 2 milligrams per kilogram. You want to stop the inflammation. You want to stop the process. And then you should also put some sunscreen. This is a product that we have in Italy for animals. I do not know if you have products for animals, sunscreens. So anybody from the companies out there, this is a nice idea to produce a sunscreen for animals, but high potency. We want at least 50. This is 50, you see? That is very important. Because otherwise, you get squamous cell carcinoma. And the squamous cell carcinoma, you see that it is the white parts of the body, because this is, of course, developing in the white cats. In squamous cell carcinoma, you have both the proliferation. You see here that the skin is proliferating as well as the ulceration. So when I see proliferation and ulceration together, I know it is already squamous cell carcinoma. Pemphigus, we're going to talk about pemphigus tomorrow. The main lesion of pemphigus is a pustule. When the pustule dries, it will cause a yellow crust, because pus is yellow, right? So here you have yellow crusts, and the typical localization for pemphigus in cats and in dogs is on the pinna, particularly the inner side, so the concave part of the pinna. You see it here, you see it here. When you see yellow crust in the inner part of the pinna, the concave part, you should always think pemphigus. Very important. And then in cats, we have a disease that is called auricular chondritis. And this is a strange disease where there is an inflammation of the cartilage. And it is very, very painful, very edematous. And you see that it is all swollen. And this cat has had a chondritis. Here is very swollen, very painful, and with time it will actually lead to an important deformation of the pinna. So sometimes you will see cats that have this deformation of the pinna, and you know they have had auricular chondritis. And this is a disease that you have to treat with high dosage corticosteroids. It is very painful. You have to treat with high corticosteroids for at least 1 month or even more, because if you stop too soon, it will come back. Remember that deformation of the pinna is not only caused by auricular chondritis. We have seen earlier the deformation due to corticosteroids. So due to Cushing, due to excessive iatrogenic corticosteroids, remember this deformation. And once you stop the corticosteroids, the ears will become normal again. So this was a survey regarding the diseases of the pinna in cats. Now let us talk about otitis externa. Now, what is otitis externa? It is an acute or a chronic inflammation of the external ear canal, and it is quite rare. If we consider the otitis excluding ear mites, maybe it is only 1 to 5% of the cats. if you compare it to 10-20% of the dogs. And this is something I think that the vets are not aware, because if you really would look into every dog's ears that comes to your practice, for example, for a vaccination or for some other disease, and you look in the ears and you smell the ears and you check with cytology, you will find a lot of otitis. And that is also a source of income, because if the dog has otitis, but you laugh, but I mean, are you working for the glory or are you working for money? For money, right? So you have to make money. So you open the ear, you see that there is an otitis, you just don't just treat the otitis. You tell the owner, your dog has otitis, most probably it has an allergy, and then you start with looking about the allergy, the diet and other things. So this will start a process that will lead to more visits, more consultation. In cats, we don't have so many otitis. Allergic cats not so frequently have otitis. Now we say that 80% of allergic dogs have otitis. In cats, it's only up to 20% of allergic cats. And in cats, we say, consider that the cat has a parasitic otitis, otodectes, until proven otherwise. Because this is by far, particularly in the first line veterinary clinics, the most frequent cause of otitis. But what are the causes of otitis besides otodectes? Well, otitis is a consequence of multiple factors. And we recognize these factors as predisposing factors, primary causes, secondary causes, and perpetuating factors. And that is a classification that has been proposed already many years ago. So let us see what are these factors. The predisposing factors are factors that increase the risk of developing otitis. But alone, they are not able to cause otitis. Primary factors are causes that alone will cause otitis. For example, ear mites. If you put ear mites in the ears of a cat, he will develop otitis. Secondary causes are the secondary infections. For example, the bacteria and the yeasts. They are not the primary cause of the otitis. They always come in the ears because there is an underlying cause that will favor the infection. Bacteria and malassezia, they live normally in the healthy ear in very low numbers. When we see them in the ears in high numbers, when we have a bacterial otitis, they have caused this infection because they were allowed to do it, because there is an underlying cause, like an allergy, for example. They are never the primary cause, they are the secondary cause. And then there are perpetuating factors. These are factors that hinder, that prevent the resolution of the otitis. I was mentioning before, if you touch the cartilage and it's hard, you have a calcification of the cartilage. This is a perpetuating factor. This dog will always have otitis because it will never cure because of the cartilage calcification. Okay, now this has all been well described for dogs. And the question is, are these factors also good for cats? Can we apply these factors also to cats? Nobody has looked into that. So what I'm going to do is to check if the same factors that apply to dogs could also be good for cats. So in dogs we have iatrogenic causes as predisposing factors. And in fact, we do have some owners that think that their cats have dirty ears and they constantly clean them. I'm sure that you have had this. There are many cats that have dirty ears, but if you check the cerumen, it's sterile. There are no microorganisms, it's not a bad odor, it's completely normal. The cats are not inflamed, they are not itchy, they are just cats that produce a bit more of black cerumen. You leave them, but the owner knows they don't like it, and so they have to clean it. And if they clean it, they can predispose to secondary an otitis. They may use irritant topical products. they may need to clean these dirty ears, and that is an iatrogenic factor. Also, if we use some products that are too strong for cats. Cats have a delicate skin, delicate ears. There are some products for dogs, for example, those that are surfactant, that contain hydrogen peroxide. They are very irritating for cats. You should not use them in dogs. Obstructive disease. Now there is a nodule in the ear that will predispose to the development of otitis, neoplasia. Now you have to know that while in the dogs, the ceruminous gland neoplasias are usually benign, in the cat, they're usually malignant. Like the memory tumors in the cats are more malignant. These are apocrine tumors. The memory tumor, the ceruminous gland tumors, they are apocrine tumors, and they are malignant. So they are often carcinomas. You see with cytology, very malignant image, and here you see the tumor. So in this case, you should make a radical surgery. Some cats, and I'm talking particularly of Persian cats, so you have a lot of Persian cats, they have multiple apocrine cysts. You may have seen it. It's called cystadenomatosis, and these are blue, black cysts. When you puncture them, there is only sweat in there, and they can be very multiple around the opening of the ear, all around the eyes, and they can be also seen in the ear canal. And of course, they trap cerumen, maybe they give an obstruction to the air circulation, and so you can have otitis due to the presence of these cysts in the ear canal. And of course, we have auditory polyps. I'm sure that you have heard about this, the polyps in the ears of the cats. These are inflammatory lesions that will start in the middle ear, and this is inflammatory tissue that will either get through the Eustachian tube in the pharynx, and you can pull it out when you open the mouth, or it will rupture the tympanic membrane and get inside the external ear canal. And so this is what you see. This is this pinkish material, and it is completely obtruding the external ear canal, and this will lead to a otitis. Many times it is a monolateral otitis. So if you have a monolateral otitis, you should think that there is something in this ear. It can be a tumor, it can be a foreign body, it can be a polyp. What do we do with this? We usually pull them out. And then you have to give corticosteroids for at least 1 month after pulling them out, because otherwise they will relapse. You get a relapse if you don't give corticosteroids. Okay, these were the predisposing factors. Now let us see the primary causes. These are the diseases that on their own, alone, are able to cause an otitis. And otodectus is the most frequent cause of otitis in cats, up to 55% of the cases. And I'm sure that you have all seen them, either with the otoscope, you see that they move, if you have good eyes, or under the microscope. There are many, many numerals. They are mating very often, and they're easy to diagnose. And this is an electron microscope. They have this coffee grains aspect, coffee powder aspect, this blackish material in the ears. But remember that the ear mites, they can also get out of the ear, and sometimes they can cause pruritus on the face. So remember this, if it's severe, they can also invade the face and get pruritus on the rest of the face. Another mite that can cause otitis is Demodex. This is very rare in cats, but if you have a very immune-suppressed cat that has demodicosis, sometimes you may even see the Demodex in the ears. And that is a nice case by my friend Silvia Colombo. She is the co-editor of the Feline Dermatology book. And this cat was FIV positive. He was pruritic, He was treated with corticosteroids for 1 year, plus was FIV positive, so it was very immune suppressed, and he developed demodicosis even in the ears. And you can see here, the demodex of the cats are much longer than the demodex of the dogs, so you can recognize them. So he had a demodicosis in the ears. Oh, they move. No, they don't move. Yeah, the video is moving, but the mice are not moving. Here, maybe this one. So it's a video of dead mice. Okay, well, you have seen it. Okay. Now, sometimes we can cause severe drug reactions. There are some antibiotics, polymyxin, neomycin. They can cause irritation with big drug reactions. And this is one of these cases where this cat had a big drug reaction. In this case, the ear becomes very painful, very swollen, very irritated with ulceration. And this occurs quite quickly. So the history is my cat has a mild otitis. I put ear drops, and after some days, the otitis gets worse. What does the owner do? He puts even more ear drops, and then it gets even worse. So this is the typical history. Allergic diseases? Well, this is a cat that scratches a lot. You see here, it scratches a lot, and it also has a malassezia otitis. But as we have seen before, allergy is the cause of otitis in cats in only 20% of the allergic cats. So this is not so frequent. Dermatophytosis. There are some cases of dermatophytes that are also found giving infection inside the ear canal. And if you think about it, the skin of the ear canal is exactly like the skin of any other body area. It may even have hairs, glands, and so it can get any infection like in other body areas. Okay, so these were the primary causes. The secondary causes, as I said before, are the microorganisms that will complicate the otitis. So they come on top of this. Here we have a whole series of bacteria that have been described causing otitis in cats. And of course, we have malassezia pachydermatis, which is also quite frequent. Now, what is the prevalence of bacteria and yeasts in normal cats? So this is a study that has checked it. Staphylococci are found in years in up to 70% of the cats. So in low amounts, it's normal to have bacteria in the ears. Rots are less frequent, and of course, they are much more frequent in cats that are allergic. But not always they give otitis. They may be more numerous in allergic cats, but not always they give otitis. Malassezia, very frequent in normal cats, up to 83% of normal cats, very frequent. Nearly every cat with allergy has malassezia, but again, not always gives disease. It is usually asymptomatic. And then one word regarding biofilm production, because this is a very important concept. Both bacteria and malassezia, they produce biofilm. And biofilm is one of the reasons for treatment failure. So what is biofilm? So here you have the bacteria, and they are in the planktonic form. So they are separated one from the other. They get on the surface of the ear, and here they are attached to the surface of the skin. And you remember that allergic animals, they can attach the bacteria and the malassezia much more than healthy animals. Once they are attached, they start to grow, to multiply, to become more and more numerous, and at one point they make a colony. And this colony, if these are biofilm producers, they will produce a very slimy material, like mucin. And this slimy material helps attach much better to the substrate, but also helps protect this bacteria. Just imagine that the bacteria are in this slimy material, and you arrive with a chlorhexidine ear wash. It will not reach the bacteria in here, right? So they will be protected. Also, the bacteria in this colony, they are not multiplying very much. They are not, replicating. You know that the majority of the antibiotics is working on the replicating phase of the bacteria. So if the bacteria in this colony, they are not replicating very much, the antibiotics will not help. So this is a very resistant form for bacteria, and there are many bacteria that produce biofilm. How do you recognize it? Well, you see this slimy, amorphous material in the cytology, and also you see that you see it here, it is slimy, the exudate. So be careful to recognize this, because if you see this, the antibiotics will not work as well. So this is the minimal inhibitory concentration to kill Pseudomonas, and also maybe the same is for Malassezia. The blue is for colonies that do not produce biofilm. The red is for colonies that produce biofilm. And here we have different antibiotics, enrofloxacin, gentamicin, neomycin. You see that if the bacteria produce biofilm, you need to double the amount of antibiotics to be effective. And here, 4 times so much, and here 10 times so much antibiotics to be effective. So that is a very big problem. So I do not know which products you have against biofilm. In Italy, we have a combination of tris-EDTA and N-acetylcysteine. You may have a similar product. You may have N-acetylcysteine because you have it. This is for when you have a cough. Yes, so you can use N-acetylcysteine liquid topically in the ears to help eliminate biofilm. And if there is any company here, if you want to produce a combination of tris-EDTA and N-acetylcysteine, this works extremely well in the ear washing to eliminate the biofilm. Okay? And then perpetuating factors, chronic pathologic changes, gland hyperplasia, edema, stenosis, calcification, and of course otitis media. If you have otitis media, you will have your otitis externa over and over again. Okay, now, but what do we practically do when we have a cat with otitis? How do we approach it? So first of all, you do a fresh microscopic evaluation of cerumen because you want to check for otodectes. If there is no otodectes, if there is otodectes, you give isoxazoline, whatever you want. If there is no otodectes or demodex, you do a cytologic evaluation of the cerumen and you check if there are bacteria, yeasts, neutrophils. You may have pus in the ears. Is there a biofilm? Then you do otoscopy. You look in the ears, which for the cats could be quite challenging. Maybe you want to put it in sedation. Before and after the ear washing. So you want to check how is the situation before you wash it and after you wash it. And you want to look for polyps, neoplasia, how is the tympanic membrane. And if there are some unusual lesions, you may want to take a biopsy. Ear washing, very important. Now, the ear washing, we want to use, first of all, something that will dissolve this material. So we need ceruminolytics. It eliminates the cerumen and the exudates. When we have cleaned the whole ear, we want to put something that will dry the ear canal. We do not want maceration and will disinfect the ear canal. So we're going to use disinfecting and drying agents to eliminate the microorganisms and avoid the maceration. The problem is that cats are not dogs, and the majority of the products are made for dogs. So which products may I use in cats? The very, very strong ceruminolytics cannot be used in cats. In cats, you can use products that contain squalene, propylene glycol, glycerin, and salicylic acid. And these are the molecules that are ceruminolytic, but they are not too toxic and irritating for cats. These are mild ceruminolytic molecules. And then, which disinfecting and drying agents can you use? Chlorhexidine, but look at the concentration. This must be quite a low concentration because chlorhexidine may be dangerous for the ears of the cats. Lactic acid, salicylic acid, and 3-CDTA have been shown to be safe. And I would like to talk, what if we have a suspicion of rupture of the tympanic membrane? Saline solution, very, very, very important is that it should be at body temperature. If you make an ear washing with cold water, and the cold water will get to those nerves that I told you before, the cat will finish the ear washing with the Horner syndrome. And he will be like that for a couple of days. And the owner will not be very happy. Because these nerves are so sensitive and they can get lesioned by the coldness of the water. So the water must be absolutely at body temperature if it gets to the tympanic membrane. Vinegar and water, squalene, 3-CDTA, and you should avoid chlorhexidine in the middle ear. However, the studies that have examined chlorhexidine toxicity in the cat are very, very old. And so they have examined 0.05 or 2%, which is a very high concentration, and they have put it in the middle ear for the cats, for 3 days. And then the cats were killed. So I don't like this study very much, just by the fact that they have killed the cats. And they have checked the 2% concentration, which is very high. In fact, it does damage to the hearing, to the balance organ, to the nerves. But the 0.05 concentration, they only gave a small surface damage and a mild damage to the nerves. One must ask, is it clinically significant or not? So most probably, I think that at a low concentration, 0.05, that could be possible to be used in cats. And this is my cat, and here is how you wash. You use, this is a ceruminolytic, and then you massage it, and then you clean it, and you take all the cerumen out, and you want to flush the ceruminolytic afterwards. If you flush it, you will get all the cerumen, and also these chemical things that you have put in the ear, you will get it out. So you flush it with warm water until it is completely clean, and then you put the disinfectant. So you can flush with just a syringe, you can use some other means to flush it. Remember that the water should be warm, and then if the cat is sleeping, you can aspirate all the liquid in the ear just by this feeding tube so that you have it nicely clean. Once it is completely clean, you can also aspirate with an aspirator. Remember that if the tube has a lateral hole, you should cut the tube here in order to get a terminal hole. And then you put the disinfectant after that, the essiccating disinfectant. As I said, owners must be informed about the side effects because you can get Horner syndrome, peripheral vestibular signs, and usually they are transient. But you should tell the owner that this can happen at home to the cats. Okay, you have cleaned the ears nicely, and then you just send the owner home with a therapy. What should the owners do? So they should also try to wash the ears. They should try to put the liquid in the ears of the cat, massage it, and then the cat is shaking the head, and this is going to keep the ears clean. And 1 hour after having done this, they should put eardrops. And the eardrops are chosen following the cytology. So if we find malassezia, we have to give eardrops that contain antifungal agents. If we find bacteria, and we have to use eardrops that contain antibacterial antibiotics. And this is a purulent otitis. You see that there is a lot of neutrophils and rods, I would culture in this case, because if it is Pseudomonas, we can have a ruptured tympanic membrane, and we have to give antibiotics by mouth. And in order to choose the antibiotics, we have to do a bacteria culture. But in fact, most of the eardrops that we have do contain antifungal and antibacterial molecules. So that is not a big problem. And it is also very important that you give eardrops that contain a good corticosteroid, because you have to decrease the inflammation. So for malassezia, we use chlorhexidine as a washing, and then we use something that contains an imidazole. And in Italy, we have one that contains posaconazole that is the most, this is not working anymore, this is the most effective imidazole against malassezia. When we have a bacterial otitis, we use chlorhexidine, but we also use products that contain tris-EDTA. I don't know if you have products that contain also tris-EDTA. It will arrive, just arrived? You have, okay. Because what does tris-EDTA do? It will improve the penetration of the antibiotics inside the bacteria, particularly on gram-negative bacteria. So if you see rods, you think these are gram-negative. You wash with tris-EDTA, and then you give the antibiotic drops, the bacteria will be killed much more, because the tris-EDTA potentiates the antibiotics. And here you have different antibiotics that are put in these eardrops. In fact, the concentration of these antibiotics are so high in the topical ear products that they will kill the bacteria. So that should not be a problem. And then, very importantly, we need glucocorticoids. And the more potent they are, the better it is. We have products that contain hydrocortisone aceponate, and this is a very potent, very good glucocorticoid, like we have seen before, for example, for azotic. Azotic would be my first choice for a bacterial infection. Do you have osurnia? You don't? Okay. So glucocorticoids are very important. Sometimes if the otitis is very severe, I give glucocorticoids also orally, because I want to decrease the inflammation. Because they decrease the production of the exudates, the fibrosis, and you have also potent glucocorticoids that you can use. Now, my problem now is, this is all the products that we have in Italy. Of these, which ones are registered for the cat? These. Okay? Of these, which ones can be used in a cat with the ruptured tympanic membrane? This. So we have a big problem with products that are registered for cats, because most of the products are not registered for cats. And there are some, for example, Neptra, that you do not have, that are absolutely contraindicated in cats because they can be toxic. They have propylene glycol. So you should really be careful to check of the products that you have, which ones can be used in cats and which cannot, because cats are not small dogs. And you don't have osurnia. So with that, I'm going to finish my talk. So for example, Neptra, which is one that is highly used in dogs, would be very toxic for cats. So you have to be very careful. Okay? I still have 1 minute and 20 seconds for questions.
Round of applause.
Thank you. And don't forget to save the money to come to the Congress in Boston next year. Put it in your agenda. Save
Round of applause to all of you, please.
welcome to all, one and all who are here today. We welcome you for the award session of the second Indian Congress for Veterinary Dermatology. This is a special time where we would like to honor the dignitaries, the achievers, and the sponsors, as well as all those who have worked behind the scenes to make this Congress a great success. First of all, we would like to honor the speakers of the day. Dr. Kaira Naudi will be honored by Dr. Nagarajan B., the President of the Association of Veterinary Dermatology, India. Will be honored by Dr. Ramani Jairam, the Secretary of the Association, by Dr. Venkatesh. Outstanding Contribution Award goes to Dr. Umesh KG, who will be honored by Dr. Nagarajan B., the President of the Association of Veterinary Dermatology. Dr. T. Satyamurthy, Dr. B. N. Nagarajan will be honoring him. Dr. V. Jnana Prakasham Award for the best research paper in large animal dermatology goes to Dr. Meera Sakale. We invite Dr. Venkatesh to kindly honor her. For the best research paper in small animal dermatology goes to Dr. M. Chandrasekharan. Kindly come forward.
For the contributors to make this ICVD2 a grand success. Dr. Pothiappan, Treasurer, please come on to the stage. I request Dr. S. Venkatesh to hand over the award. Editor. Dr. Ramani Jairam, Secretary. Dr. S. Venkateswaran, Vice President. Dr. S. Karniappan, Joint Secretary. Dr. Meera Sakhare, Editor of the newsletter. Dr. Sumati, Editor. Dr. D. Chandrasekharan. Dr. Suraj K, CPD Director, Sava, and Director of Kochi Pet Hospital. Dr. Shibu Simon, President, SAVAC. Dr. K.G. John, President, CAPAC. Next is Dr. Gokul V, Animal Medical Center, Angamali, Kochi. Mosafia Hospitality Center. Mosafia Hospitality Center. Bipin Babu, Holiday Inn. Bipin Babu, Holiday Inn. Adra Vasukutan, Holiday Inn. Dr. Nilesh Shindu. Dr. Nilesh Sindhu. Dr. Annie Varghese. Nasim EP. Dr. Gauri Menon K.
Dr. Preena P.